Hello, everyone. I am John Adkison. I am once again doing another interview for the Circumcision Harms docu-series that I intend to put together, and I am interviewing with Kyle Casey today. Say hi, Kyle, and tell us a little bit about yourself and how you ended up here.
Hello. Well, my name's Kyle. And I'm 24 years old. I basically just living the life of someone in their late, I guess, early adulthood period. Um, just got a standard career and 9 to 5 kind of life. But uh, what brought me here was it was honestly something that I'd always kind of realized was a little bit odd, right? Like, why do I have these scars and stuff like that? Um, and then just kind of, I was always one of those people that would Google the living daylights out of anything, right? I'd always like to just read. My friends think it's weird because I like to read Wikipedia articles for fun, and I'd go in there and just read and read and read, and I got to this point where I was just like, it was about when I was 15, and I was like, what really is, because my mom had always, I had learned about, what I guess, quote unquote, what circumcision is when I was a child, right? I don't know how long, for as long as I can remember, but I never really knew exactly what it actually involved and what it actually was until I was about like 15, and that was when the rabbit hole just started opening up and getting deeper and deeper, and it was about, I would say, like, when I was about like 18, and getting a lot more sexually active and stuff like that, that man, the depression hit with all that really hard, and the fully in-depth realizations of everything
Yeah,
just kind of freight trained.
I hear you, man.
So
That's a story I hear often from people as they learn about the harm that's done to them. So I'm curious. You said that you started learning about this when you were 15. Did you have any thoughts about suing when you turned 18?
um no, I never really, like, I never, I mean, I'd kind of figured that was kind of a snowball in the back, right? That had just been building up, and
Yeah.
uh, it really was my, I think my 22nd birthday. I started calling around to different law firms and stuff like
Yeah.
that,
Me
and
too, man.
wanting to pursue, and then they're basically just like, well, I mean, is it botched? I'm like, well, no, but it's it's a
Well,
surgery that I didn't ask for, right?
define
And they're like,
botch. Yeah.
yeah. So they're like, well, nothing we can do. And so I just either got phone calls or emails or actual physical letters back from these. I basically called up anyone and everyone up and down the West Coast, and
Yeah.
couldn't.
Yeah, it's a tough thing. I've actually been trying to figure out ways to convince guys, young guy, teenage guys that, by the time they turn 18, they should have this figured out, and even before they turn 18, start talking to lawyers to look into suing because you have a really short window
Yeah,
to do anything if you're going to want to get any kind of retribution on this because you got the statute of limitations, right? And
yeah.
that varies from state to state. And
Because I was born, so I was born in Orange County, California. So I was actually even looking up into the like, with all the Boy Scouts of America rulings and stuff like
mhm,
that. I was even looking at pursuing into that because it's
yeah,
unwanted sexual
yeah,
abuse.
yeah,
So
yeah, exactly. I don't quite get how. I guess you'd have to find a judge that could see the connection. It's like it's sexual battery of a minor, as far as I'm concerned. So if like Boy Scouts of America can get sued for something that happened years and years and years ago, why
yeah,
can't we sue um, doctors or whoever for doing something that happened to us years and years ago that is sexual battery?
Correct.
Um, but I think they jump to the statute of limitations because they look at it as a medical procedure. Okay, well,
Well, I mean, amputation of anything, right? If it's done in a hospital is quote unquote, there's a lot of things that are, if it's done in a hospital is quote unquote,
yeah,
medical procedure,
medical,
but
yeah.
I don't, yeah.
I disagree with that. I don't consider it medical just because a
Yeah.
doctor,
Just because a doctor did it doesn't mean it's a quote unquote medical procedure.
exactly.
It's just, yeah.
To me, it's a ritual. It's still it's just an old ritual that has been um, put into hospitals or clinics um, using surgical tools. But I don't consider it medical because being born male is not a diagnosis,
No, yeah.
right?
It's, there's no,
No indication.
being born male syndrome that,
Yeah,
everyone's affected with at birth, right? Apparently we're the only country that being born male is an actual, like medical symptom that requires the most drastic of medical means.
yeah, exactly. So yeah, because of that statute of limitations, it's like typically 2 years. That's another thing I'd probably
Yeah.
pursue changing in the U.S. at least is making that statute of limitations a little bigger because um, and or addressing the what do you call it equitable tolling um, statute where you can set that clock to the point where you learn about the harm because like if you are in a coma for a year or whatever
Yeah.
and the harm was done at the beginning of the coma, well, the clock should start at the end of the coma,
Yeah.
right? Not at the beginning of the coma. So, I've been in a coma for 18 years as a child.
Yeah. Yeah.
I found
Basically,
out that when I was a baby, I got cut. So,
I mean, as children, you've kind of got the wool pulled over your eyes for up
yeah,
until you're 18, right?
yeah,
You're kind of going with the motions and dealing with the uh, the insanity that is just growing up, just trying to be an adult,
hmm
right? And then once you're set free, I mean, yeah, that's when you start realizing all these things that,
yeah,
oh, maybe it's, maybe I've been lied to for
hmm
25 years or something.
yeah, yeah, exactly. So, well, that wasn't exactly on my list of things to cover, but that's
Oh, yeah,
it's really
sorry.
interesting because I not a lot of people, not a lot of men have started figuring it out when they were teenagers. Um, and the teenagers I've come across were they act dumb or whatever. I don't know. They act like
Yeah.
teenagers. They're very
It's the internet era.
yeah. They're very they'll start calling me names or whatever. Just jump to ad hominem, and I guess it's probably maybe it's a certain level of cognitive dissonance. They don't want to face the idea that they're harmed or that their parents made a bad mistake or whatever. But
Yeah, you're still in that, golden years of your life, quote unquote, I
yeah,
guess.
yeah, and
Or,
you've already had no time to even consider the idea that something you're missing something down there.
yeah,
But yeah, there are
like,
cases where guys like you started figuring it out around puberty or so, right?
because it really, I mean, like I guess it would be the next stage. It's kind of like a point to that where it's you start to really realize that something it is, I guess, wrong with you or was wrong done to you, and
hmm
it was at like the and it is wrong, and it was kind of also just at like at the behest of all the people you've trusted, right? You've trusted doctors all your life growing
Yeah,
up, right? You're a kid, so you trust doctors, right? Or you'd think,
yeah.
or
I
you
did. I did it when I was
like,
35. I was
yeah,
about ready to let my first son get cut because I believed that they wouldn't be doing it such a by the large numbers that they've been doing it without a good reason, and it wouldn't. I mean, how would they do that for so many years to so many boys for so long without getting in trouble if it wasn't you know
yeah. Why would
bad?
someone in a position to quote do no harm
Yeah,
just voluntarily do harm,
yeah,
right? And so it was so it's still that, I guess, that young age of thinking that certain people, I guess, have morals still, and all that. And I mean, it that kind of, I mean, the glass facade kind of shattered for me. Um, Kind of, it was around my like 22nd, 23rd birthday when I was calling up all
Mm,
those lawyers and everything. Um, it shattered so hard that, I mean, I haven't spoken to my parents since. I kind of cut them out because I know it's, you know, partially not their fault, right?
yeah.
It's society and all that stuff, but I just, I can't bring myself to not find guilt in their hands as well.
Yeah, yeah. You're a lot younger than I am. I mean, you're like about half my age. And back when I was born, there was like nothing out there. I mean,
Yeah,
I interviewed one person. She went into a library and found some information that she had to use. She had to use rubber gloves to find out, and she saw the stuff from like Dr. Kellogg, and
yeah.
when they were
It,
pushing it for anti-masturbation and stuff like that. That's all that
Back in
all that was
those
available
crazy
back then.
days, yeah,
Since then, I mean, 25 years ago or so, there's been a lot more stuff out. So,
yeah.
yeah. All right. So, I've got this list of things that I
Roger
go
that, yeah.
through. What's that?
Oh, Roger that. Yeah,
Yep.
there's a list. Yep.
Yep.
Forgot
Yep.
about that.
And um, I'll go through the list and I'll pause between each item, and I want you to speak up if it applies to you, or if you've got something to say about it or whatever. Okay. Hey,
Roger
don't
that.
don't feel like you need to. I mean, if it's too personal or whatever, that's I understand. This is kind of a taboo subject, and we talk about we talk about genitalia here. We talk about your
Intimate,
personal
yeah.
area, so private parts. So okay, so there's I got six major sections. Physical, which we talk about the physical harms, and then we get into partnership, sexual partnerships, and how they're affected by those physical harms, and we get into the psychological effects of the harms, and not just the harms done to the individual that was physically harmed, but the world as a whole, society as a whole, people across the board. It seems to me like almost everyone is somehow affected by this. Ritual genital cutting in the world.
Mhm.
And then we have relationships and how that gets affected by all of this. And then I delve into FGM, or female genital mutilation, a little bit to talk about the connections and all that. And then the last but not least, social productivity and how that's affected. So one of the first thing I start off with the physical aspect is the word acropostion. And John Geisler he did a presentation. I got him to do a presentation at a baby fair in Bellevue, Washington, and he showed an image of a statue from, I think it was a Greek statue or whatever, and it showed an intact penis, and it had the part hanging over the end of the penis past the glands,
Mhm.
and that's called the acropostion, and that supposedly was the part that was removed um, during biblical era or whatever. It wasn't the entire prepuce.
Yeah.
Um, but later on, uh, supposedly because the rabbis got wind that Jewish men were trying to restore, they were pulling their prepuce forward so their
They
glands could be
started cutting more
covered.
and more.
Yeah,
Yeah.
they decided, well, maybe we should cut more so they don't try to do that, or make it a lot harder for them to do it at the very least. So yeah, so nowadays most cuts involve a full preputial amputation, so everything covering the glands is removed. So the idea is that most everyone, you know, is
Yep.
what about the way that the penises are
Which
expected to be seen as
they're
in the
complete erect
USA.
state. Yeah.
Yeah.
I mean, because it's locking it down into. I mean, because I've also researched into this as well. Because I mean, I was researching up that in ancient Greece, uh, having an exposed glans was considered indecent.
Exactly.
Um, and so they would restore to bring that back, and also just to get get back to being normal.
Yeah.
And no, can't have any of that. So just
Yeah.
start removing everything, and that's just basically what it's boiled down to as a modern circumcision, where everything is just torn off,
Yeah.
which locks it, I think personally, like sickeningly into a, you know, an erect looking state.
Hmm. Yeah. Yeah. And yeah, a lot of women say, well, it looks better that way or whatever. Or even men say that it looks better that way. It's like, well, you realize that you're when a woman is looking at it, they're like, you have a certain, I imagine, at least I'm not a woman, but I imagine that
Yeah,
women are wired to think that it looks better because that's supposed to be telling you that, hey, he's ready for sex.
yeah, it's that innate, that innate monkey brain that we have that's
Yeah.
looking at that and going, oh yes, that's good sex, right?
Yeah.
But it's not supposed to always be like that. It's supposed to be protected so that the sex part is actually decent.
Yeah. 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 So anyways, sensitive skin, it's as it has been proven by the Sorrells study and even the Bosio study. But a lot of people have issues with the Bosio study because of the way that Jennifer Bosio summed it up. But both the studies proved that yes, it is sensitive skin. It is highly innervated skin. It is highly vascularized skin. I mean, you can look at intact penises and you can see the blood vessels in it. So glands protection. Even the AAP in the early 70s wrote, and like I think the very first statement from the AAP was, "It's there to protect the glands of the
Hmm.
penis."
Yeah,
For some reason, it was taken off, and it's not even mentioned anymore that it provides any
I
kind
mean,
of protection. But
it's kind of one of those things of it seems common sense, right? Or that it would be common sense, which I
yeah,
guess isn't so common, that it would be there to protect it, because right, I mean, look at all the other different types of mucosal membranes
yeah,
that you have on your body, right? Your eyeballs have eyelids
protected.
to
Yeah,
protect them, right? Your
yeah,
mouth has lips to protect them, right? So you have this sensitive mucosal membrane that is supposed to be covered and protected. Look at all the mammals.
yeah.
Every mammal out there has a
I think there's two.
you
If
know
not, but yeah,
yeah,
like
yes,
platypus.
yeah, platypuses. There you go. But like they always have like a covering over their genitalia. Even like non mammals. You got the oh man, I like reptiles and I forgot what that was called. But they, everything has some sort of covering for a very intimate and a very important part of their body. So, how would us humans, right, with that innate, monkey brain part of us, somehow flip 180 and go, no, 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 no protective coverings are allowed. Just
Yeah.
cut it all off.
Let's cut off our chip, our teeth, our lips, so it's easier to brush our teeth. Yeah,
Exactly.
it's
Yeah.
cleaner. It's cleaner.
It's cleaner. It's cleaner.
Gosh. Uh, it also provides because it's a double fold of skin. It's not a flap of skin. It's a double fold of skin. It unrolls as it goes down the penis, and that depending on various men have various amounts of their prepuce available, but
Mhm.
some have some coverage even when they're erect, and that provides a rolling mechanism for sex. So when things slide in and out, there's not as much friction, right? The
Correct.
things
Yeah.
kind of stay put as things go in and out. And there's moisture and lube, or moisture, which is lubrication.
Mm-hmm.
So the male brings lubrication to the game too, not just it's not all dependent on the female. And often people talk about how uh, you know Americans need far more lubrication. They need to go buy
Lubrication and
KY jelly or whatever.
super sensitive condoms and all
Or
that greatness,
yeah,
right? Right.
or
Which,
you watch the movies, the American movies, you know,
yeah,
about lotion. Guys getting lotion out to masturbate.
exactly. I
Yeah,
mean, because it's it's you're not supposed to be, just trying to completely rip the skin off, right? You're
Yeah,
supposed to just be gliding the skin, the loose, all that, looseness back and forth, and you're not supposed to be just dragging your hands roughly across, the surface of a very sensitive part of your body.
exactly. Yeah, and I've heard so many like intact men from other parts of the world say, "What the frick?"
Yeah, why are you? Yeah,
Yeah,
you gotta use
I watched
lube. You
this
gotta
movie
use
where they're getting lotion out to masturbate. It's like, what do you need lotion for?
exactly.
Yeah, it's very sad though for us men,
It
us
is.
American men. Frenulum.
Hmm.
The frenulum pretty much always gets affected one way or another, maybe completely affected depending on how much is cut. I've heard of guys that where the surgeon like freehanded right up underneath the gland
Yeah,
and completely carved out all the frenular area.
I have seen witnessed some that they have basically looks like they've taken out a friggin' like melon baller and scooped the damn thing out.
Man,
It
it's,
is. I don't know if it's slight. I was gonna say I don't know if it's TMI, but I mean we've been having it is gonna be an in-depth conversation, but I'm at least I would say a little bit lucky in the sense that uh, I guess to quote my dad, the doctor free-handed mine, and luckily he left a little bit of that, basically half of it, I guess,
mm,
or at least a quarter. Not to the level that I've seen on a lot.
yeah. I'm very lucky myself in some ways. I'm unlucky because I have a very tight cut,
Yes.
but I'm
Yeah.
lucky because I have like all my inner mucosa. So
Oh,
I
nice.
think that if I was able to manage to figure out a way to stretch the little bit of shaft skin I have, I'd have full inner mucosa coverage on my glands. So it would be all inner mucosa instead of having like shaft skin covering my glands.
That would be nice. Yeah.
So
Luckily, I mean, I was cut. It's the problem I have is it's a grower, not a shower, and so I will have, and I luckily I'm at like a, I guess using that C scale or whatever chart, I'm
CI,
at like a, yeah, the CI, yeah, the coverage index. There we go.
yeah.
Um, Probably like a, I would say luckily like a 2 or 3 when
Oh,
it's flaccid.
mm-hmm.
Um,
Lucky.
but when yes, but sadly, like when I'm erect, it is completely stretched out to a point where it's
Yeah.
almost painful.
Yeah, and that's the next thing is I'll hear in a little bit. We'll
Oh yeah.
talk about some of those pains or harms and all that. So, and then on top of the frenulum, for those that are watching that haven't watched other videos, the frenulum is similar to like the part underneath your tongue that anchors your tongue down.
Mhm.
The frenulum is on the penis is supposed to help pull the the prepuce back up when things relax instead of just leaving all the skin down on the shaft. And then there's the ridged band, and this is I often hear it referred to like the lips of your mouth. It's the
Mhm.
part that goes from the inner mucosal part out to the outer part, your outer skin, and and it's kind of muscular too. It's the skin closes up, especially when a young child, and creates like a one-way sphincter, so things can go out but not come back in, and when erections occur, that gets stretched out. And I've often heard that even that process of the ridge band stretching out as it gets pulled down the and stretched out over the glands is a sensation by itself. So all of these things that are missing causes problems like hairy shaft from
Mhm.
scrotal webbing because the scrotum is hairy. So it's since you don't have the prepuce to roll down onto the penis, you're pulling up on the scrotum and you're pulling up on the pelvic floor. And like I've seen videos, porn videos where uh, these guys' balls were sucked up
Yeah.
and on one on each side of the shaft of the penis for me, it goes so far, or it used to go. I'm 50 now. My scrotum is stretched out a little bit from age, but when I was in my teens and 20s, one of my balls would often pull all the way up into my body, and I'd have to stop, relax my erection a little bit, and push it back out. So,
Sadly, I mean, so I've luckily not witnessed that, but that webbing, it's I mean, I almost get like it's like a combination of angry and ill whenever I see this, like on myself. If I ever am just, you know, exploring, right, and I look down and there's like it when at full erection, it basically pulls that scrotal webbing like halfway down the shaft, and it's just, you know,
yeah,
you can
same here.
basically, it's like seeing the outline of the train, or like out the not just outline of the train wreck, the in depth, like the results of the train wreck of that. And
Yeah,
it's a very defeating um feeling
yeah.
when witnessing that, because you're like, there's basically nothing I can do to remedy this.
You can try restoration and do all that, that tugging and stretching, put weights on
Yeah,
your penis or whatever, and tape and all that. And as I haven't had the guts to do that myself.
I've
I've
been restoring for probably about a year. It was about a year hardcore, and then this most recent year has been very off, and then a little bit on with restoring.
yeah,
It's the motivation factor has dropped significantly,
I hear you.
just because the depressive layer has gotten a lot
Have
bigger.
you ever attended any norm meetings? Is that something that's an option for
I
you?
have I have not attended any more norm meetings. I mean, I would like to know. I'm in the Seattle area, so
Oh,
I'd
okay.
like to find some and
Hmm.
attend and kind
Yeah,
of group.
look it up. I feel pretty lucky down here in LA, because the guy that runs it, started having Zoom meetings,
Okay.
and so I've been able to attend those. I'm not personally restoring, but I do find it interesting, and quite often, after everyone's done chatting about restoration, the talks about anti-activism and everything start up. So I find it interesting then too. So
Awesome.
I do. It's like I ran into another guy that actually has a very tight cut, it's very similar to mine, and he's been trying to restore for years, and that just hasn't made much progress at all. And yeah, that's
All
more
right.
reason why I don't really want to get. It's just too much energy for me. So yeah. And like I said, I already covered the testes.
Hmm.
So like the testes can get squeezed from the scrotum too, and it's almost like getting kicked in the nuts, but it's not that tight, right?
Yeah.
So, but yeah, it's like it's really freaking frustrating because it's like you're feeling pain and
And
erogenous feelings all at the
yeah.
same time, right? It's like
Right.
I
It's
think of BDSM.
yeah, exactly. Yeah, that's. I mean, kind of what I was thinking about as well. When like, because I mean, erections every now and then are can be painful, and uh, when I was more, um I mean, more active in restoring and everything, there were certain parts that had started to become, I guess, dekeratinized or less
Mhm.
keratinized,
Yeah.
um, around the corona, and it, man, stretching that now sensitive and not protected part of the skin was, that was man, there was almost like a month where I would try basically every day, you know, young adult, right?
Hmm.
But and just couldn't for about a whole month just because of the pain.
Yeah. Frustrating. It's just
Yeah,
it's mentally challenging to even think about trying to restore. It's just not something that we should have to be doing.
exactly.
um, and then the pelvic floor. So for me, when you got the corpus cavernosum, which goes all the way into your body up to the anus, right to
Mhm.
right to your anus, and it fills up with blood, and that's what causes your penis to come out of your body, stretch out of the body. Um, well, when you don't have enough skin on the top part of your penis, your penis does that. It does kind of like
Yep.
a crane
Yeah,
thing.
I've seen some pretty horrific curvatures like
Yeah.
of that. Luckily, I don't have that so much on the top.
Hmm.
That's where I guess the to get I guess descriptive, the looser part of the cut is.
Good. You're lucky.
The bottom is pretty tight, but I mean, uh, the most I've got is I guess some extra scar tissue on the left, so it has it
Mm-hmm.
kind of rotates around that position.
Mm-hmm.
So
So it
uh,
curves a little bit to the, you said, to the left.
to the left, yeah, and it's got
Okay.
I mean, and it's one of those after all these years of exploring. When I first figured out about circumcision itself, or I mean, I guess like when I first started researching it when I was like 15, that's where I figured out like, man, that is like, because I know there's curvatures, whatever, right? But then I was like, that's feeling that up. That's scar tissue. That's not like
Yeah.
actual, like
Yeah.
just fat or whatever of the, and other bits of the penis. That is
Yeah.
scar tissue that is caused by
And
yeah,
pretty much anyone that has a scar can touch that scar and know, well, it doesn't feel anything like the rest of the skin. There's,
exactly.
scar tissue doesn't grow nerves. So, or at least not fine touch nerves,
Yeah.
Yeah. Uh, okay. Oh, and a little more on the pelvic floor for me. So, like when
Mhm.
my penis does that,
Yeah.
it's kind of like taking a balloon and twisting it that way, and it kinks, right? And then if my partner does something like this, then I get a double
Yeah.
kink. All right, kink, kink, and it does not feel good.
No.
Gotta can't do that. Okay. Okay. So pelvic floor. Oh, myelostenosis.
Hmm.
So the part where the end of the
Narrowing of
urinary
the
tract
yeah.
kind of closes up, or in my case, and I've heard of other cases where you get a little skin bridge
Mhm.
across, and it has to be like cut out or drilled out or whatever.
Yeah, there's a uh, I was researching into that more recently. I've been rewatching King of the Hill, and
Mm.
they're always talking about Hank's narrow urethra and stuff like that.
Oh,
And that
really? I didn't catch that.
yeah, yeah, they're always talking about because he only had Bobby and stuff like that, and can't get in or have any more children because of his narrow urethra, and I was like, huh, interesting. I wonder if that's I
Yeah,
wonder if that is medial stenosis,
exactly.
but yeah,
Crazy. Oh, yeah, the more that I've thought about it, the more I realized, I think I probably still have a certain level of myelostenosis.
yeah,
And I had the skin bridge that was really quick and easy to fix, and I was like, I don't know, 7 or 8 years old. I have very vivid memory of that.
jeez,
But I even when I'm urinating at my current age, it feels a little sharp when I urinate
mm,
right there at the end, and I've seen pictures of intact men's and next to
yeah.
one that's cut, and it's like, yeah, there's definitely a clear difference.
I mean
Yeah.
that you're talking about having that corrected at 7. That's one of those things that always mind boggles me. Right? Is so we're gonna cut this thing off to save
Yeah.
having to get antibiotics for urinary tract infections,
Yeah.
and maybe we'll stop. We'll do a 0.01% increase in the chance of not getting this cancer,
Yeah.
right? Something
Yeah.
negligible, right?
Yeah.
But then we're going to cause just years and years of medical toil and strife because of all
Yeah.
the corrections that we have to do to
Yeah.
to fix a what should have been right, or what is hailed as the one fix for all.
Yeah. Yeah. Well, hopefully, well, their medical professionals will continue to figure out the harm more and more, and that's why this is why I'm doing
Yeah.
these interviews, is to I've heard the harms from not just my I haven't figured it out just for myself after talking to intact men and stuff like that, but talking to guys that are cut, and their various kinds of um, symptoms they've had.
Mhm.
So want to get that out there so people hear it enough. I even what's frustrating is I try to bring this up with my own primary care physician, and he just didn't seem to be interested in talking about it. So, when they're not interested in talking about it, then they're not going to be documenting, oh, this guy has this side effect or that side effect from
Exactly.
being circumcised when he was a baby. So
Oh, it's
then
just
it
something
never hits
else,
the
right?
statistics,
Yeah.
right?
Yeah. They always want to put it on something else, or
Yeah,
diminish the fact that, oh yeah, this the I don't know, the massive I mean, it is, right? The amount of blood loss and everything, the massive surgery this man had done on him when he was an infant, where
hmm
they excised half his penis skin, um, is maybe might cause some problems.
yeah, exactly. So, yeah, uh, yeah. Okay. Oh, skin bridges. This is something that happens because the inner mucosa of the prepuce and the glands are attached, much like the fingernail, to the bed of your finger
Hmm.
when you're a child. And when they break that apart, then you might have a little bit of inner mucosa or whatever left down here, and it's trying to reattach itself
Yeah,
via
you're
like scar
putting the
tissue to
body
it.
into its a panic repair itself state,
Yeah,
and
uh,
yeah,
and scar tissue is not a good thing
no.
for any part of your body. Yeah. Then the next thing is erectile dysfunction, something that is
Hmm.
often at least definitely seems to be an effect. I guess
And
there's been some
I
studies.
can confirm. Yep, as a 25-year-old, I shouldn't be having these problems, but
Yeah, for sure.
yeah, that is something that I have um, witnessed and I guess was affected by. I
Mhm.
mean, uh, there's I just have I will have yes I it's kind of like uh, it's embarrassing, but yeah, no, I've definitely been a victim of ED,
Yeah.
and it's been very rough and emotionally toiling.
Yeah. Yeah. I personally have a hard time sometimes getting excited because I know there's something missing down there, and yeah,
Exactly.
you've
It's
got two causes of erectile dysfunction, not just the physical aspect of the state of
correct.
your
I would say it's
genitalia.
about 50-50 on the whole. Yeah,
Yeah,
I've
the brain is it's,
yeah.
I keep hearing the brain is your largest sexual organ. It's like,
Hmm.
well, yeah, if your brain is thinking, well, dang it, I'm missing something down there. I wonder what it would feel like if I had the whole thing. It's
Exactly.
a big
Right. What am I
distraction, darn it.
missing out on? Right.
Yeah,
It's kind
big
of
distraction.
obviously there there's something completely missing right in front of you that your brain just cannot distract itself from.
Yeah, yeah. So, that's definitely not going to be good for your partner either.
No. Yeah.
Uh, not going to be a turn on for your partner when you're dealing with that stuff. And then the general botches, and you talked about how you curve a little bit because
Mhm.
you were cut too much on one side. Uh, but there's
Yeah.
so many other botches. I mean, there's
Yeah.
cut off glands
The,
because they put the
the
clamp in the wrong place, or
yeah.
they use like plastibell and they put the string on wrong, and it somehow
I've
flips
been
off or
reading
whatever.
so many horror stories on the Brother K Facebook page,
Mm-hmm.
and the circumcision harms and all that stuff. And I've so I am bisexual male, and I've had many partners and stuff, and I have I I would say it's almost half, if not more. It's I would say like a 5 or 7 out of 10 of males that I've been active with, that it's completely botched. Like, right? I mean, I would call all of them a botched medical procedure because it's
Well,
unnecessary surgery, right?
yeah,
But um, for it to be like something is completely wrong here, right? That
yeah,
is honestly like 50 to 70%.
Yeah.
of
Wow.
guys that I've been with, that you can see on it like there is like a eighth inch like step around the whole where the inner foreskin tissue has been attached to the shaft tissue. There's like around that scar line. I've seen one where it was honestly like an eighth inch step.
Wow.
It was bad, and it looked so painfully tight.
Yeah.
I've encountered men who have had I mean, it gave them basically a micro penis.
Hmm. Oh man.
It's attached so tight that you could feel that there was something more there, but it was just the pressure was so, you know, I mean, they cut so much off that it's just, you know, trying to fit, you know, I mean, trying to wear extra small socks basically is the best way
Yeah.
I could describe it, right? That sock, that skin is not going anywhere.
Yeah. I just had a thought. You got inner tubes inside of bicycle tires, right?
Yeah,
If you were to take an inner tube that was bigger than what the bicycle tire was designed for, and then try to pump it up, the inner tube's going to like crinkle, right?
exactly.
Well, that's what the penis is like. The corpus cavernosum is the inner tube, right? And then the skin is the tire. So if
Yeah,
you've taken too much of the skin away, then the inner tube's going to
there's
start doing weird things, or causing things to be stretched out too much. So,
exactly.
yeah. So yeah, I think SPU did a study that found over 11% are of circumcisions are botched. But yeah, how they come up with that number, I'm
Yeah,
not
and
sure.
then
But
what they consider botched is
yeah,
like,
um,
would you consider having an eighth inch rib around your entire penis
yeah,
botched or not?
yeah, and the guy that you saw probably has never reported it or talked to his doctor
No.
about it or anything
Yeah.
like that. There's like yeah, I mean, doctors don't seem to want to talk about it, but like Jay Jackson, the guy that wrote this book right here, he
Hmm.
he talks about how many urologists and oh, cosmetic surgeons he's or plastic surgeons that he spoke with, and how he got chased out of the office and everything else about just because he was complaining.
Jeez.
Uh,
I mean, and you talk to doctors that are not, that are not from the states, and they, I mean, I've talked to a few, and it's kind of they're just completely stumped, right? Because they know, right? There's the kind of widely known knowledge about just the, I guess, state of the medical system in the U.S. and all that stuff around the world, right? But and so like I was talking to some doctors, and they knew that, right? And they're kind of poking fun at it and stuff like that, and right. And then I got on the topic, turned to circumcision, and they were just completely mind blown, right? They were just like,
right.
wait, they do what at
Yeah,
every child? What? Hold
yeah.
on, right?
Yeah, I'm very appreciative when people from other countries jump on and try to help us, U.S. and tact us out and say, hey,
Yeah,
we don't do this over
there's
here, and you guys are
yeah,
nuts.
exactly.
Yeah. So yeah, I imagine the botches are far more frequent than anyone has
Yeah.
any clue about. Okay, so that's all the physical harms, unless you can think of anything else that I might have missed.
um No, I mean it's pretty spot on point, right? You're I mean having issues where erections are causing skin to tear and bleed, right?
Hmm.
You're having all this stuff that is a direct consequence of um, amputation of a very large part of a male sexual organ
Yep.
that should be there for. I mean that is directly there to have sex, right? And that
Hmm.
whole thing is that you're protecting it, you're causing a sliding action, right? You're keeping, you're making, your body's producing lubrication and all that, or providing
Yeah.
lubrication, all that stuff, and you're directly removing probably the one of or you're directly removing the most important part of the male sexual organ.
Yeah. Yeah. I agree. Yeah, a lot of guys that take the time to figure this out
Yeah.
say the same thing. So, and it is a very large part. I I used this one time, and I was a little shocked myself. I didn't really expect it to be what you know, what I've heard. But I took a I've got this on video on my YouTube channel. I had one of my
Mhm.
kids take a video of me as I was doing it. But I took a ruler and measured, what would have been cut off, when you consider where the corona of the glands is,
Mhm.
and just rolled it down. And then I measured there, and then I did my measurement around. It's like, huh, that is 3 by 5.
Yeah,
How
that's
about that? That's actually 15 square inches, just like they say.
yeah. And I was talking to one of my coworkers about that, and it just kind of we got on this conversation a little bit. He had saw, and every now and then I will uh, be honest, and every now and then I will rage on Facebook a little bit at certain like mothers groups and stuff like that, right? Where
Yeah,
they're it'll be most of the people actually on board with the intactivists and everything, right? And then
yeah,
you have a few people that are just constantly going on about, you know, oh no, I don't want my child to have a disgusting turtleneck and all
yeah,
that, right?
yeah.
Um, so it kind of caused a little rage, and I didn't know that it was public. So my buddy
Oh,
sends me a message. He's like, "I'm boarding the plane right now. Also, good job with what you're doing." Right,
ah,
and this is
awesome.
one of the guys I'd been talking to at work, and he's very much one of those people like I'm fine, there's nothing wrong down there and all that stuff,
Yeah,
and I mean after the winter vacation, I mean coming back, he was talking about like, man, I cannot believe, like was reading up on all the stuff he said, I cannot believe that it's actually 15 square inches of skin that
yeah,
is removed, and
yeah.
it does all this to my sexual organ, just completely basically nerfs
Mhm.
the whole thing.
Yeah, yeah, and this, if you look at this thing, it doesn't even have, I think I'm getting my yarn stretched out, but it's like it doesn't even have much hangover past the
Yeah,
glands. It's like a lot of penises have a fair bit more hanging over, so it
yeah,
could easily be a lot more than just 15, but.
true,
Yeah,
true.
but I think that I am personally very thankful for intactivists because I have two sons that are intact, and they wouldn't be if it wasn't for someone passing information on to my wife.
And
So thank you
congratulations on
for
that, because you are a
what's that?
that I mean, and congratulations on that. You are one of the growing number of great parents that have realized the damage that it causes
Yeah,
and are helping the next generation to have their body.
yeah, yeah, yeah. Okay, so we're jumping into the partners section of it,
Alrighty.
and you said that you're bi.
Yes.
So you've been both heterosexual as well as homosexual
Hmm.
activity. For myself, my partners, some of my partners,
Mm.
will get torn because get too excited or whatever, and not work up things and get everything wet and lubricated enough before
Mm.
starting. And when I push, I'd tear um, my partner.
Mm.
Luckily, for some reason, I haven't torn myself, but my partner would
Yeah.
tear. So it does affect the partners when there's something missing.
Exactly. Yeah.
And then you have anal, and with anal, there's
Mhm.
no lubrication at all.
No.
eh, I'm, but if you have an intact penis, well, you have both the rolling mechanism and the lubrication on the glands and inside the inner mucosal part,
Mhm.
right?
Yep. I've I guess TMI-ish, I guess. I am
I'm not
I'm
worried about TMI with this.
roger that. All right. So I am basically, I mean, uh, for the most part, I was very strictly toply when it comes to my personal, my love life. Um, and then because I encountered um, I encountered uncut, right? I mean, I've encountered cut for most of my life when it came to anything back there to anal, but I recently decided to kind of I just experiment a little bit,
Hmm.
and man, having someone who is fully intact, it makes everything just. I mean, it the sensation is completely different.
Yeah.
It doesn't
But
feel like. I mean, it doesn't feel like sandpaper. Is basically the only way I could describe it. Right? It doesn't. It's the body actually moving how it should be moving, right?
yeah.
The rolling function and all that stuff is actually doing what it should be, right?
Yeah.
So I mean, that was my one of my most recent encounters, and then after that I was curious and experimented again, but they were uh circumcised, so it did it didn't go. It
Yeah.
hurt. I mean, is the best way to describe it.
Yeah.
I mean, yeah, it's that whole rolling and smoothness and
Yeah.
everything is completely removed.
Yeah. And you can use lubrication, but there's different
It,
kinds of lubrication. There's like
yeah,
water-based stuff that dries up, so you have to add
exactly.
more. And then there's other stuff that's messier to clean up and all that. I
And yeah,
was
nothing beats. I mean,
the real
that
stuff.
that that real stuff. Yeah, the natural
Yeah.
lubrication. Nothing has ever come close.
Yeah. And then the last one underneath partners is homosexual docking.
Mhm.
And I like to pick on Jim Jeffries here. I don't know if you've seen Jim Jeffries' episode where he goes and interviews Alon Cerrone, and I think he like mocks Jonathan Conte and stuff like that. And he in his show he talks about homosexual docking. He didn't
Mhm.
know it. And he talked about how homosexuals will dock, and,
Yes, yeah,
and that doesn't work unless you have an intact penis.
exactly. Yeah,
You can't dock without the prepuce.
true. Yeah, it
Otherwise, you just
doesn't. Just the tips. Just
yeah, you're crossing swords.
right. Exactly. Right?
Yeah,
There's nothing moving there. There's no movable parts, right?
yeah,
It's like having a Matchbox car versus having a model, right? One has
yeah,
no moving parts, and the only fun you get is just kind of pushing it back and forth, right? The other
yeah,
one, you can open up the doors, you can move things about it whole,
yeah.
you know.
So as much as Jim Jeffries was trying to bash Intactivist or whatever he was trying to do, at the same time he raised awareness. So thank you, Jim
Yeah,
Jeffries.
there you go.
I hope you see this sometime. Give me a call. I'd be happy to talk to you on your show. I actually went and protested at two of his venues in the Bloodstained Pants outfit.
Nice. I gotta get myself one of those.
Yeah. Okay. The next section is psychological.
Hmm.
Many psychological harms. What in the many ways that we're all psychologically harmed. And first of all, obviously, start off with the trauma from the cut itself. Now,
Hmm.
you were cut as a baby, right?
Yeah.
Good.
Less
Sorry
than
that.
I because I to describe it perfectly, I grilled my parents on this, and yeah, they I was cut like 24 hours after I was born, and like it um really hurts, and it really just kind of uh, crushes me knowing that, right. So when I was born, I have my mom and on my mom's side we're Native American. We get Native American blood from them, so we're olive-ish complexion. And
Oh.
so when my sister came out, she was born 7 years before me. When my sister came out, they were like, "Oh, this baby is jaundice. We got to get her into the ICU or the NICU and all that stuff, right? And get them under the lamps and all that, right? Just because olive complexion and
Yeah.
doctors know the best, right?
Mhm.
So I mean, they did the same thing with me. So it kind of really crushed me knowing that um, the first embrace that my parents ever had with me was post everything, right? Was I wasn't I I like to say, and it really does hurt, but uh, I would say that there's there's two versions of me, right? There was the me I was born as, right? Fully
Yeah.
intact. I have my body, right? I am myself. And then there is um, me that is manufactured me, I guess. The post circumcision, the factory child, right? So there's the naturally born, right?
Yeah.
Fully,
I hear you.
fully intact baby, and then there's the manufactured baby. And the only contact my parents ever had with me was the manufactured baby, because they hauled me off, put me in the NICU, and
Right.
then um, wheeled me off to go get
So you
circumcised.
didn't like even have time to bond with your mom.
Nope, no bonding allowed. Nope, none of that. Just
Uh,
complete
yeah.
um, dissection and
Yeah. Wow.
package it up, and there it is.
Yeah. To a large part, the hospitals, and this kind of goes beyond this topic, but
Mhm.
the hospitals uh, try to act like um, Ford,
Yeah, it's
making machines.
exactly. I was reading up on the post recently about the the parent that was talking about witnessing her son, and they had basically put him in a factory line. They had all the like stroller things all attached to each other, right? And they were just going down the line. They had the babies in each stroller had one of the circumstraints, right? And there
Oh,
was like 8 babies or so, and they were just going
gosh.
down the line, just chopping them up. I
Uh
mean,
huh.
that
As
is,
efficiently as possible.
yep, that is the most ridiculous thing,
Assembly
right?
line. That's the
Yep.
word I was looking for. Yeah.
Yeah, assembly line right there, right? And
Yeah.
there's no, I mean, there's no, patient care. I mean, even yeah, they're a 10 hour old baby, right? That's still a
Yep.
human being. That's
Exactly.
still a
Yep.
person.
Yep. And this was treated a lot like McDonald's. You want fries with that?
Yeah, yeah.
You
I
want a
mean,
circumcision with that?
exactly. I saw someone posted, and that was like the best way I could describe it was, right. Your parents are renting their children. To
Yeah.
to describe it well, the parents are renting their children for 18 years. Right. Once the child is an adult, fully and legally, right, that is their own complete separate person. They're always their own person,
Yeah.
but they just are under, they've always been and will always be their own individual person. But and you're, as a parent, you're just, you you know make sure it's watered, make sure it's fed, right, and make sure it has a
Yeah.
roof and it's got schooling and it's taken care of.
Yeah.
Well, I mean, immediately, you know hawking it up into the factory line is not taking care of your child.
No, I
um
don't think so either.
it's chopping it up immediately from birth, and you know uh, cutting out, I forget how that term goes, cutting off your face to spite your nose or something like that,
Hmm.
right? You're doing, a 1 inch step forward to do 20,000 steps backwards
Yeah.
is not the best way.
Agreed. Well, thanks for sharing your story about that.
Oh, thank you.
Uh, so that's a trauma from the cut. And then there's several other stories I've heard about. Like Brother K didn't eat for I guess a couple days or whatever after he was born, after he got cut. Um, I've heard plenty of stories like that
I,
where
I,
babies they won't breastfeed or anything like that because they're
I
afraid of
don't
the pain.
remember if my parents, I mean, because when I grilled them on that whole thing about the situation, I mean, I don't remember them talking about anything like that, but I do know. So what really, I mean, it kind of bothers me because I was basically wanting um, a play-by-play of how it all went and everything.
Hmm.
And so my mom had told my dad, um, prior to being born and everything, do not let him, because this was in the 90s, and that whole like scare, I guess, of children's being kidnapped out of the uh,
Or
God, what
switched to
is that
birth,
ward
or
called? Yeah, just swiped at birth, all that stuff was
yeah.
starting to come around, and my mom was like, never let him out of your sight. Always be there with him every single place. Well, um, so as my mother was recovering from the birth and all that stuff, my dad was describing how it went, where he was keeping me in his sight at all times, and then they wheeled me off to go get circumcised, and he said that he joked with the doctor about and told the doctor, leave some extra, because he
Mhm.
my dad has always liked to talk about that he dabbled with medical stuff and all that stuff. My grandfather was a plastic surgeon, um, but and my dad had always kind of been. I mean, shoot, I'll just straight diss him, because I mean he was never really part of my childhood. Um, he had always just kind of been this silver spoon child, and kind of in the shadows, and coddled his whole life, and wanting to be there, trying to, oh, I want to be a dentist, or I want to, do all that stuff. So he'd always kind of dabbled with medicine, I guess, whatever was kind of like uh, trickled down by my grandfather. And he had said that, oh, around that time he had kind of learned something, that the foreskin might be important or whatever. So he told the doctor to leave some extra. Yeah, might be important, huh? All
Nah.
right. So yeah, and they wheeled me off out of his, into that, I forget that room that they call it, but into the circumcision room, and chopped me up out of his sight. And my mom did say that she was very angry at my dad for literally just right there leaving him out of his sight.
Yeah.
But there never, I mean, that was the I mean, most ridiculous thing that I'd ever heard was just, oh, leave some extra. Like, I can't, no.
Yeah.
And standing by the door, he had to have heard the screaming and crying, and I can't believe, like, I
I've
don't
had
know,
some really
as a
good
parent.
soundproofing.
Yeah.
Yeah, sometimes I often wonder that babies that don't cry, they're not crying because
No,
it's
they
not
go
that
into
they don't
shock.
feel
Yeah.
pain, but they either go in shock, because I mean they can go in shock like that before they even cry,
Yeah.
or they feel the pain but they don't know what to make of it.
Exactly. I
They're still
mean,
young. They haven't
yeah, they're less than
like
a day old into this world,
what is that?
right? And
I
and,
feel
and
something down there, but I don't know
yeah,
what it is.
I had done research on this, and it was, I think it was either 95 or 96. It was I think I have the research study somewhere. It was the Canadian Canada Health, or whatever the Canadian Medical Agency is called. They did a study where they took like 100 babies, and they were going to perform circumcisions, and they were going to um, anesthetize half,
Yeah,
and or quote unquote anesthetize half, right?
yeah,
It doesn't work all that well on an infant.
yeah,
So they were going to try that and see what the psychological effects are from doing that, right? That
yeah,
what's the happening in the baby's brain as we're dissecting, the most sensitive part on its body. Well, I was reading up on the study, they had to stop after
yeah.
5 or 6 babies, because they literally were, the doctors had said that every
Torture.
baby that we are going on, that we are performing circumcisions on, is going into shock.
Mm,
Every single child, and they're like, we couldn't ethically continue on with this
yeah,
research.
yeah,
It's yeah, it goes against our Hippocratic oath.
yeah. I was making fun of someone on Twitter that said, they're a nurse and they've seen this and whatever. It's like, and they're like, they're not in shock or whatever. They're not feeling pain. I was like, oh yeah, how do you know? You got some sort of things connected to the brain or whatever to tell?
Yeah.
You monitoring their heart rate and all that good stuff?
Yeah, you're gonna tell the
No.
baby to squeeze your finger,
Yeah.
and
Yeah. Do they say
feel the
anything?
pain, right?
No.
No, no,
How do you know then?
exactly.
Didn't have an answer.
Yep.
Ah, yeah, I blows my mind. Some of the things that come across, like, you made it through nursing school or medical school, and okay.
Yeah, and somehow you made it through all that and don't know how the nervous system works. Cool.
Yeah.
All right, that's hope.
Yeah. We'll get into that old doctor-patient relationship thing in a while.
Roger that.
All right. So the next thing is trauma from the discoveries of the loss slash harm, and you said that you started learning about this from like age 15, and
Yeah,
kind of got more riled up by the time you were 22, something like that.
it was as I progressively got, or I mean, as you do around that late teens period, right? You start getting as I was getting more sexually active,
Mhm.
the less the feeling of, oh, I'm fine, da 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 da. The more that started wearing off, and the more of the, holy crap, I'm seeing the world, and I'm seeing everything out there, and all the differences and variances, and what it has done to me, and what I have what I've had done to me, right, and my effect on that, and holy crap, there's something wrong here. And that started just getting progressively that realization was getting progressively larger and larger, and it I've always been kind of angry at the fact that I was cut, right? I'd always kind of had this innate thing of some sort of, I guess, perfectionism of like, I want I was born with that, I want that, right? That is part of me, I want me. Well, so that had always been there, but then it had always been drowned out by, no, I'm fine, da da da, it's cleaner, da da da, right? And then after researching and researching and researching, and everything I'd been, every path down the road that I had tried to take to try to come out to the other end of being, oh, I'm fine, right?
Yeah.
Had always ended up turning into,
More
oh,
anger.
this is broken, right? Or
Exactly.
this is a symptom of it, like, oh, and then anger and depression, and I've been in a state of just really bad depression.
Now, you familiar with the 5 stages of grief, right?
Yeah.
Yeah.
The I forget them off the top of my head. But
It starts off with denial.
Yes.
You know,
Yes.
the deep river in
Denial of it.
Egypt.
Yeah.
Yeah. And then at the very end, it's acceptance. But
Yeah.
For me, it's like I went through those stages multiple times. I didn't just do it once.
Exactly.
You know, I haven't ever met an intactivist. I haven't met an angry man that just figured this out and went from being, oh, I'm fine, to being super angry the next day. It's kind of like
it's a
progressive
constantly
thing.
revolving door of what am I going to feel today? Like, what, maybe I am right. Maybe I can get everything together, and maybe I'll just live with it and be fine with this. And then, no, I'm not going to be fine with this, because I'm, there's always something missing, right? And it's just that constant cycle. And it always just, I would say it always leads to depression, but when it leads to the depressive part of it, it feels like it's just stacking boxes in a room, and those boxes are just stacking and stacking more, and it's never emptying the room out and going through the whole thing again over again. It's always just, oh, this is the depression part, shove that into the depressive closet, and it's been overflowing and just hurting.
Yeah, I try to think of it this particular way to try to satisfy myself a little bit psychologically. I think of people that have gone off to war and have lost a limb because of war.
Yeah.
Right. Now, with that though, it's kind of an expectation that might happen.
Correct.
Right. There was a reason for it, whereas there aren't any good reasons for the fact that I was preputially amputated.
Exactly. That's the kind of theory I've come up with too. Is so, because I've had major spinal corrective surgery, and that's a huge thing in itself, right? And it's caused numbness in my leg, and just overall general pain, because you have titanium and bones meshing, and I'm living up here in Seattle, and it's
cold and wet.
Cold
I'm
and
from
wet.
Washington.
Oh, yeah, that's right. Yeah, you were talking about that. Yeah, it's cold and wet, and then it's hot and wet, and it's constantly fluctuating around, where we've had days recently where it's dropped down in the 30s one day, and then it's up in the mid 40s the next, right? So there's this constant pain, but
Yeah.
and this huge scar on my spine and everything. And I can kind of, with that, I can parse that out in my head and be like, okay, well, there was a problem, right? There was a
Yeah.
54-degree S curve in my spine. Well,
Wow.
it was
Oof.
quite impressive. And so at 16, it was corrected, right? And
Yeah.
that I can parse out, right? There was a problem, it got fixed.
Yeah.
Well,
There
there
was
was no problem. I was,
Exactly.
there. If 75% of the world can be
Yeah.
totally okay with this, with having this part of their body, and not have any complications, right? Then why? What was wrong with me? Why was I not just okay, like
Yeah.
this other 75% of men in the world? Why
Yeah.
why did I have to have preventative, stuff done to
Mhm.
me? And it's always, I mean, my excuse, or my uh I guess questioning of my parents, right, on the excuse of, well, I mean, it's, preventative, cool, yeah, for like 0.01%,
Yeah.
to lessen the 0.01% risk of penile cancer. All right, cool. So I mean, why did my sister not have her breast removed when she was a baby,
Mhm.
right?
Yeah. But
To
1 in 8
prevent breast
chance.
cancer.
Yeah.
Yeah.
1 in 8 chance.
Why isn't that a thing, right?
Yeah.
Or
For sure. It's a whole lot higher of a chance than penile cancer. A 1 in
exactly.
1,000.
Yeah, it's why didn't you cut off my fingernails so I didn't have to clean under them, or
Yeah.
have the
Toenails.
chance of ingrown toenails or anything like that?
Yeah.
Why why didn't I have, because I grew up and I had a lot of dental problems. Why didn't I have all my teeth knocked out
Yeah.
so I could get them replaced with veneers, right? Why don't we just remove, all the adult teeth as soon as the children teeth are done and all the adult teeth come in? Why don't we just knock them all out, put veneers in, never have to clean them? You're good.
Yep.
No, we don't do that. Well, cool. Well, why do we
Yeah.
dissect and mutilate the most sensitive and one of the most sexually important um, objects,
Mhm.
parts of a boy? We It
Because of the
makes
fox with no tail.
exactly.
Yeah.
It's I
What
don't know.
the fable. I just tweeted about it earlier today. Yeah, but the fox with no tail syndrome. Yeah,
It's
started thousands of years ago, and I've just been having a hard time letting it go.
Yeah, it's like along the lines of that. It's the same thing as, and I deal with this at work all the time as well. Is It's the banana with the it's the monkey and banana on a ladder. That experiment. I don't know if you're familiar with that, but it was like back in the 50s when they could get away with doing this. They put shock collars on monkeys and put them in a room, and then put a big tall ladder with a basket full of bananas on top of the ladder.
Mhm.
Well, monkey climbs up the ladder to get a banana, they'd shock it. Well, they kept doing that for
Mhm.
weeks and months, whatever, and then they introduced a batch of monkeys into that group that don't have shock collars on them.
Mhm.
There's no risk of them going up the ladder and grabbing the bananas. But the monkeys with the shock collars would violently beat the monkeys with no shock collars if they tried climbing the ladder.
Yeah.
Because if you're going to go up that ladder and get the banana, we're all going to get shocked, and that's a dumb thing. So don't do that. Well, I
That's
don't
a good one.
know. Maybe look at the rest of the world that can freely climb up the ladder and get that banana, and go, hey, maybe we can actually do that here.
Yeah.
But yeah, I don't.
That's a good one. I haven't heard that one. That's a great one.
Yeah. I remember watching a documentary on it somehow, but yeah, but
Yeah.
it's the same kind of thing though. Of
Exactly.
what's holding us back from joining the good part in the rest of the world of not mutilating babies right as they're born, or not finding a problem with babies right as they're born.
Yeah.
Like I can get my grandfather, being a plastic surgeon, he would fix children's hair lips, and he would go down to Mexico and fix children's hair lips pro bono and stuff like that. And I mean, I can understand that, right? I mean,
Yeah.
there is an
Because there's a birth
actual
defect.
there's an actual direct birth defect that is is causing the children problem and stuff like that, right? Having a penis is not a birth defect.
having the prep use is, in
Yeah.
fact, they often think that being born without one, forgetting what it's called now, but
Oh, the intersex, I think, right? Or
well,
it's
there's intersex too,
for...
but being born without a postia,
Oh,
being
yeah.
born without it is considered a birth defect. Yeah, but intersex people will argue, no, don't call us birth defects.
Yeah.
We're just born different, and we're okay with it.
Yeah.
So,
Yeah.
it all depends on the specific intersex person. It's kind of a little more complex with intersex, but
Yeah.
yeah, my
I'm
attitude
not
is
100% familiar with all that, so I was just
yeah,
like, is it where it's I have no idea. I know the term, and I'm like, all right,
yeah,
and I think I know what
DSD,
it means, but yeah.
yeah, development of development of sexual disorder or sexual
Yeah.
yeah. Anyways, and all the intersex people hate that term too, but yeah, that's it is what it is. And I
Yeah.
guess there are some cases where yeah, if they don't do something, then the child's life is at risk. And I say, okay, well, that would make sense. That would be a medical indication to address. But
Yeah.
if
But
the child has a large clitoris or a small a micro penis, whatever,
there's
do you really have to fix that?
you really you don't have to.
Oh,
It's again, it goes into you don't need to modify
yeah.
what's down there if it's if it's not I forget the other terms where like the other medical things where it's completely either not there or
Mhm.
it's split in half, whatever, right? That's corrective. There should be something there, and it's either not or it's completely mutilated. We got to fix
Yeah.
this. You don't go out there voluntarily just that too big of a clit, chop that off, right? Or
Mhm.
too much of an actual penis, cut that in half.
Oh, yeah, yeah. So my attitude is typically is, I always say this. We believe that everyone has the right to the genitalia they were born with. Unless there's a medical need, you leave it alone. So it's basically all it is. So yeah.
Yeah.
um. Okay. So any other thoughts on the trauma that you endured as you were discovering the losses and harm?
No, I mean it led to and it led to just a growing depression, which has I guess been ever so evenly getting worse. I would say. And
That actually
it's
leads into the next thing, which is about suicide. Have you ever
okay.
had suicidal
Yeah.
thoughts?
I have just getting straight up. I mean, it's the constant thought in my head of right whenever and it's one of these that you can't avoid it, right? Every morning you get up and you go in the shower or whatever, it's right there in front of you. You go
Yeah.
to take a leak, it's right there in front of you. It's
Yep.
always something um that's right there, and
Yeah.
I don't have a big enough gut to hide it. It's always there staring at me.
Need to
Yeah.
drink more beers.
Exactly.
Grow that belly out.
Grow the belly out. More McDonald's, come on.
Want to see that.
But yeah, it's always staring like it's always right there, and it's unavoidable, and it's led to just being that I guess the 5 stages of grief, and
Hmm.
one of the bits of acceptance that I've had, which is I mean not acceptance, but it's well, I mean I'm just I'm if I wasn't worth having, a part of my body, then what's the worth on being here, right?
Yeah.
What if I somehow was broken as a baby and they had to fix me up, then why am I just not broken? Or why, if they broke me as a baby, what's the point of having this broken thing going around? I mean, I've talked with my shrink, which I need to get another one. He had to move. Uh, and so he was trying to set me up with someone else, and I just I got lazy and depressed and just didn't follow through with it, which is bad on my part. Um, but I was talking with
You
him,
might want to
and
chat. He's not an official psychologist, but he has a psychology degree, bachelor's degree.
okay,
Jordan Arell. He actually does some videos. He has his own YouTube channel
I'll just check
about
him out.
this. And check out. You just watch some of his videos, and it might help you address, the psychological grief a little bit. One of the
Yeah,
things I actually tweeted about this one morning is, I keep thinking about, this going off to war thing. It's like, well, I could frame it this way. I was born and I came out a warrior. I fought my
yeah,
first battle almost right away. I lost. I actually
yeah,
ended up getting something cut off, but I'm still here fighting.
yeah. That's a good way to point it, or to put it out. Yeah, because I had always just, I mean, I described to my shrink that I feel like a, friggin' like a 95 Honda, or, 96 Honda that has been passed down for, the whole family has driven the thing, and right, and it's been beat to death by all the teenagers, and it's this raggedy old thing that you see, sitting on the street corner. Right? What's
Yeah.
what's the point of no one? It's the vehicle that's offered on like Facebook Marketplace for like $150.
Yeah.
Needs a fuel filter, or needs a fuel pump, needs all
Hmm.
that stuff. That's exactly how I feel about myself. Is
Wow.
what's you know I am not worth, and that's because of this and
Yeah.
all the medical stuff
I
I've had
hear
in
you.
my life. Is what's the point of keeping this thing around?
Yeah.
It's something that no one's gonna want. So why doesn't
Exactly.
it just go to the wrecker?
Yeah.
um,
That
and
sucks.
it has, and it's something that on the suicide part has been very very strong,
I hear you.
and I mean, I'm at the point right now where I do dumb things, right? I race cars as a hobby. I race cars and I
Oh,
race
fun.
motorcycles. Yeah, and it's always one of those things of there's so many just I could already do it, right? I could just, crash into a wall, whatever, right?
Yeah.
Dumb things like that.
Yeah.
But
You
I
done.
always had this hope of continuing forward. But I would say because of circumcision, it's m- it has made me suicidal, and
Mm,
it's something that I wouldn't wish on anyone else. And I don't
I hear
know
you.
how a parent could, even have the slightest risk, right? If there's a risk of cancer or risk of
Hmm.
whatever, right? That's so small. Well, why do something for that? Why not? Or, I mean, or why do something for that, and why not do something
Yeah.
uh, that would I'm sorry, I'm getting tripped on my words here. But why why take a step to prevent cancer, but not take a step to prevent suicide or
Hmm.
prevent
Hmm. Yeah.
lifelong depression
I
that
don't know how
has
many
greater
suicides are going to
risk?
have to happen before people wake up to, this.
I hope none. I mean, um, who was the guy at the end of American Circumcision?
Jonathan
Jonathan,
Conte.
yeah, Conte.
Yeah.
I mean that should have been uh, uh, a wake up call right there. And then the poor kid in Canada, 23 years old, right? He was born in the UK, right? Circumcision's not a thing there.
Yeah.
Very, very minimal, very low percentage.
Hmm.
Um, Went to Canada for a skiing trip, and I think he was there for school as well, and had how it's described. I think he had phimosis, and the Canadian doctor there, some old dude, just said, "All right, no, we just chop it off. That's our answer."
Hmm.
And he had gotten circumcised at I think in his early 20s, and then at 23, he ended up killing himself because of
Oh, yeah.
the amount of pain and the amount of
Yeah.
loss and pleasure, and they're you're numb. I
Yeah.
mean,
Yeah.
it just numbs everything. So
Yeah.
what's the
Yeah.
point? And it
Yeah.
hurts.
Yeah. That's sad. You were talking about how you look down there and you see it every day. Yeah, I often see this comment saying, "Well, they don't remember it." So I'm like, "Well, that's funny. Every time I look down there and I use it, I'm reminded that I'm missing a good part of my body."
Exactly. And it's exactly like that, right? If you talk about like a soldier that's blown up in war, right? He may have been unconscious, right?
Mhm.
He may have immediately went unconscious when he got blew up, but
Yeah,
he's still affected by getting blown up,
the loss. Yeah.
right? he's still affected by the loss. It's just because you're not, and it goes into, I mean, I've used this argument as well, right? If someone is unconscious and in a coma, or has been drugged and is raped, they're still raped. That's still, they
Exactly.
are still affected by
Yeah.
this. They
Bill
may have not
Cosby.
been conscious. Exactly. Yeah, Bill Cosby. They if they got chocolate pudding popped, I mean, but it's one of those things. I mean, it's still a bad thing, no matter if the person is conscious or can't speak. It's like, or we're just babies, right? So I mean, we were, if we didn't get completely shut down by shock, right? We were conscious during this whole event, right?
Yeah.
I mean, the problem that we had is we just couldn't speak English, right? So if something bad happens to someone that couldn't speak English and they can't describe the problem in English, does that mean nothing bad happened to them? That
Yeah,
makes no
exactly.
sense. There's
Yeah.
no way you can kind of, like, I guess, try to piece it out in a way that makes sense. It's always, you're always reminded of it, right? You always are reminded of it, and you're always traumatized by
Yeah.
that horrific action, that being circumcised,
Exactly.
right? You may not clearly remember the day, but you're always reminded of it.
I'm curious. Did you ever have any nightmares that you attribute to?
Yes.
Yeah.
So it was, I've always been a lucid dreamer. I've always, for the most part, been able to um, actually, like, have a realize that I'm dreaming, basically.
Mhm.
It's really weird,
Yeah.
but
Same here.
yeah, it, and it's only until I really started digging into it, and the depression started getting to the next level. I've been having, like, honestly, night terrors where I can't move. I can't,
Mhm.
do anything about it. I I wake up, and it's been a reoccurring dream where I wake up and I'm strapped down and I'm just getting just shredded apart, right?
Yeah.
They're just, dissected and pulled apart, and there's
Oh,
nothing I can do. I'm just witnessing this whole thing. And
you're,
it's been, a reoccurring and constant terror,
oh, it's
that I've
horrible.
had in my sleep, and just horrible dreams
Yeah.
like that.
That sounds very similar to mine, but more vivid, more specific.
Yeah.
My dreams were I was not able to move. I didn't know that I was tied down,
Mhm.
but I wasn't able to move. I was like,
Stuck.
couldn't physically move, and something was, someone was coming toward me, and I knew something bad was about to happen to me, and then I wake up every single time. And I had those dreams, I think, while in my 20s. Um,
Yeah,
I never put two and two together until more recently.
yeah, it's something that I mean, I luckily was able to directly be like, wait a minute, that's like, as I wake up and just, the cold sweats and everything, you're like,
Yeah.
that seems exactly like, how I feel about what has been done to me. Yeah, you're stuck, and you're terrified, and I mean, you're basically, your body's putting back together exactly what happened to you when you were just born.
Yeah. Yeah. I'm sorry, man. Well, thank you for being open and vulnerable about this.
Thank you.
What always frustrates me is when people commit suicide and they don't leave a letter or anything, explaining why. But at the same time, when people are going through it, they're often not thinking clearly enough to even think about how it would affect the people that they left behind
Yeah,
when they just choose to leave this life.
and that's been the big thing that's keeping me here, is just, well, maybe, if I can prevent at least one kid from getting,
Yeah,
having to experience the same thing I have,
yeah,
then that's, there we go. That's
yeah, and that
the
would feel good, right? I mean,
yeah,
the whole point of living life is to have some good feelings
yeah.
in life, right? So, yeah, yeah, I find it challenging myself to try to tell my brain to think about something else. I I don't even. I used to watch Netflix a good bit.
Mhm.
sometimes would watch, just binge on Netflix with my wife. but this is just too much on my head anymore. I feel so much. It's like my conscience is driving me to constantly. I always have these ideas about what else I could do to wake more people up and get the word out more and all
Yeah.
that. And I'm always being pulled towards doing something like this, or going out bloodstained pants, or chatting with people on Twitter and Facebook, and I even figured out how to do videos, and I've got hundreds of videos on TikTok and all that. So
Yeah, it's also affected me on like watching shows and stuff, and it I used to like watching Grey's Anatomy and stuff like that and all those medical shows, and then I can't bring myself to watch it anymore, and I can't bring myself to enjoy a lot of just medical dramas, or anything to do with medicine. I really I wanted to. One of my goals was I really wanted to get into the EMT field and paramedic field, but I got to that point where it talked about where it talked to just about just the anatomy of genitalia in itself, and I'm like, I can't.
yeah,
I can't continue forward because it's just constantly reminding me of what has been done to me, and I don't. It's shut down. Yeah.
Yeah. I've considered jobs at hospitals. I'm an IT guy, and hospitals need IT people all the time.
They pay really well.
Yeah, but I can't work at a hospital. I wouldn't be able to trust myself. I would probably I'd do something drastic to try to protect a baby from getting cut. So it's kind of funny. I actually took my mother-in-law to get I think an MRI test or whatever, and because of the COVID and everything, it's like, okay, well, you guys take her. She has Alzheimer's, so but it's like, you guys take her on in, and give me a call when you're done with her. And I went back outside, changed into bloodstained pants, and then protested right from the same hospital.
Nice. You had two birds, one stone right there.
Yeah, well, I had to sit around anyway, so I might as well do something productive.
That's actually sorry for I guess derailing a little bit. That brings you up to Providence. I remember seeing your thing about Providence Hospital up near here.
Yeah, Olympia. Yeah.
So Providence Olympia just doesn't. Do they not perform?
No, I guess none of the Providences do. It's
oh wow, okay.
Providence is a Catholic-based hospital, I guess, and it's Catholics are against it.
Yeah.
You can go to Catholics Against Circumcision, which I happen to be a webmaster for.
Nice.
But unfortunately, there's a lot of Catholic hospitals that still do.
Yeah, and I was always perplexed by that. I have a friend, a former coworker, who is devout Catholic, and we kind of got in this conversation just as friends, talking about, I was talking about my depression and all that stuff, and one of the causes for it, and he's like, he just kind of brushed it off, and he's like, well, my sons are, and they're fine, right? And I'm like, buddy, I mean, you're a devout Catholic, but you like, and he has talked. I mean, we talked about it all the time, because I mean, I'm agnostic, but I really love, and I'm open to. I love studying religion a lot. That is one of my big things that I really love enjoying and researching. And so we, had philosophical talks and stuff like that. And he always did make the joke of, as Catholics, right, we're supposed to be the like default and OG when it comes to Christianity and that whole sect, but we really don't, Catholics, we really don't read the Bible as much as we should. And I was like, yep. And immediately, like, it was a couple months after that talk we did, when we ended up talking about circumcision, I pulled up the verses, and I'm like, it clearly says right here that it's Paul was flipping tables and all that for it. It's and it's not it is quite frowned upon. It is quite frowned upon.
And people think that intactivists have actually been only going around for so many years or whatever. It's like, no, go back into the biblical times, and there's people like Paul that were arguing against this. So it's been they've been fighting this, for a long time, and luckily with the internet, we're able to get the information out there a little bit better, I think.
Yeah.
But we still have a huge hill to climb, it seems. Okay, so we covered the trauma and we covered the suicide. Well, individual trauma to those of us that are physically harmed. But then we have trauma to others. We have trauma to children. You were a child at 15, so there's that trauma, right? But I think more. I think about my own sons. They're teenagers, 14, 15 now, and they've been seeing me do these protests and chatting online and talking to people like this about this, and they're very well versed on the topic. I mean, they're totally confident enough to go talk to their friends at school about the topic, and they can totally trash any kind of BS that someone comes up with as an excuse. So they're totally confident in their own bodies being intact and all that. But at the same time, it makes me sad that they have to deal with this reality in this world.
Exactly.
Right. Now, of course, children that came before them had, even worse realities.
Yeah.
I mean, I think worldwide humanity has made a lot of progress. We don't have, slavery like we used to, and we don't have killings and horrible wars like we used to. But this is still something that I consider barbaric, and they seem to concur that it's barbaric, it's nuts. They wouldn't even consider having part of their penis.
Yeah, I have an intact friend, and I have an intact roommate, and we've talked about this too. Just again, talk about the depression on it. And he can't, like, when I start describing, like, some of the stuff, or I'll ask questions on things, and I just start describing it in vivid detail, he just can't
Can't absorb it all.
Can't absorb it all. Or it's almost like it's like watching the videos of someone getting hit in the nuts, right? And immediately you have that sympathetic, even though it didn't happen to you, you have that sympathetic, just immediate, like, gut reaction. And he definitely experiences that. When talking about it, it's just such a horrific act, and it's I mean, it affects. It's.
I came across this Muslim guy when I was out driving Uber or whatever, and somehow we came across the topic, and I told him about just one of the, we went through all these physical aspects of harm. I just covered the one thing about the moisture lube thing, that's what would be there, and he was shocked. He was like, "Man, dude, I'm pissed."
Yeah.
Really?
Exactly.
You mean I would have that?
Yeah.
Yeah. Like, man, that sucks.
That's like
then I wanted to try to tell him about the other things. Like, dude, just stop. I can't handle it anymore.
Yeah. That's like my buddy that really got him. I mean, it's the simple kind of thing that just affects all men. But really got my coworker that was cheering me on with going on that rant on Facebook that was accidentally public. He was like, "Man, I could have been longer. They robbed inches from me." I'm like, "They did. That's how it works. They're removing literally half the skin, so there's not that much it can move."
Yeah. Well, there's a study out there where it's like circumcised penises are like a centimeter shorter on average. So it's not a whole lot, but still.
Exactly.
I want my centimeter, doesn't it?
Or like I remember researching when I was like 15, and I to actually describe it really well, just violently Googling things, just never-endingly Googling everything. I was reading up in Africa and all these places where they're doing all these like the Bill Gates and Hillary Clinton Foundation, all that stuff, where they're doing these massive circumcision drives. The cases of buried penis and micropenis in those areas is incredible. It's it's actually the you watch like the graph, and as the circumcision rates are climbing. The you can see like the uptick in buried penis and micropenis, and
Wow.
it's quite interesting to see the actual effect right there of you're not getting cancer, right, but you're getting no penis.
Hmm. Hmm. Yeah, I often wonder, if they could figure out a way to fill the corpus cavernosa, make it manually fill or whatever,
Yeah.
in order to stretch out the whole penis. You fill it really full and then stretch out everything, and
Yeah.
then maybe it would um, get to the point where you wouldn't have to fill it manually anymore, and then it would just automatically fill itself and stop
Yeah.
being a micro penis or a buried penis or whatever. But
Yeah.
maybe if I
Thoughts,
could
maybe.
convince people to stop cutting
We wouldn't even have
children's
to deal with this.
genitalia in the first place,
Yeah.
maybe I'd go study medicine and come up with a way to do that. I don't know.
Yeah.
And I guess down to the social productivity part, we'll bring it up again. So I see children, even if they're not physically cut, I see children as being traumatized by this. I think of
Yeah.
who's that girl that went to the UN and cussed them all out.
Oh, Greta Thunberg.
Yeah,
Yeah.
Greta Thunberg. I think of her. She went through a period of trauma and depression and everything like that, and then she got her voice and
Yeah.
started holding a sign saying, "Hey, let's save the planet or whatever." Um, I worry
Things can
that
happen. Yeah.
there's lots of children that start catching on to this early on, and they get depressed or whatever.
Yeah. Like what? Why did this happen? It goes into like, why did this happen to my friend? Right?
Yeah.
Why are my friends having to deal with this and all that?
Mhm.
And they shouldn't be.
Yeah.
They shouldn't have to. Is the thing is they shouldn't have to. But it's just this period and wave where it's
Yeah.
becoming luckily less common, but it's also still existent and
Yeah.
it's ingrained that
I guess when I think about Greta Thunberg and how when she started protesting and she started getting positive responses and stuff like that, maybe it is good to have her kids protest
yeah,
this. I mean, and we're letting them see what the world really is like, which is sad.
yeah,
Um, but I don't want to hide children from the reality, because when they get to be adults, I need them to be ready for the world.
exactly.
So maybe having them protest is a way to keep them from getting depressed. I don't know.
True.
Just thoughts.
Yeah, letting them realize young that they are in the making a change for the good.
Yeah.
Which is enlightening.
Yeah, for sure. Give them a sense of power. Like they can do
Yeah,
something in the world, and not just because when I think depression is often a result of not having any power.
yeah,
Like, I mean, you and I, we don't have really much power to do much about what happened to us as babies,
Mhm.
but we do have power to protect the next generation.
Exactly.
So focus on that instead, right?
Yeah.
Medical professionals.
Mhm.
And you were talking about wanting to be an amputee, but it's something that's hard for you to do because of the medical profession is doing this thing,
Exactly.
particularly in the United States.
It's very much made me have a solid distrust in doctors. I mean, it's I don't like
And nurses.
and nurses. Yeah, it's made me have a solid distrust. And I mean, the other stuff that I witnessed with all my other medical problems growing up, I had so I had a hemangioma on my hip, which is a blood vein comes up to basically like the top layer of skin, and it was huge and cobbled and was like right on the belt line of my hip, so it would really easily be like nicked or messed with, and it would just bleed just
Oh,
profusely.
man.
So when I think it was like 13, 12 or 13 was when I had surgery to remove that. And well, when you're a 12 or 13-year-old boy, your just body's growing at odd and rapid rates.
Yeah.
So the doctor came out and was shaking his head, and my mom was asking what's wrong. Well, they apparently they originally, so this is actually where my first like distrust immediately kicked in, was they're originally going to do it outpatient, remove this huge, like, 4 square inch chunk on my hip.
Mhm.
They were going to remove that outpatient, and they were getting the scalpels out and everything. And
Really?
I'm like, I can't do that. Don't do, like, he's like, well, I just removed one off a knee about an hour ago. It's fine. I'm like, I can't. No, I'm not going to deal with that. You're going to come out with needles and scalpels. I mean, I'm fine with needles, not scalpels. Nope.
Ugh,
So,
put me under.
exactly.
Knock me
So,
out.
yeah, they put me under, and then the doctor came out shaking his head saying, we are glad that we put him under for this, because apparently it went a lot deeper than what we thought it
Uh,
was. A huge, like, ingrown blood vein went a lot deeper into my hip. So they took out
yeah.
a huge portion of my skin.
Wow.
Well, they didn't. And growing up, reading all my stuff about my grandfather and his medical journals, because I just started reading really young, and getting really like involved in, like, in depth reading of all this stuff. Skin grafts, right?
Mhm.
They had to take too much and made
Yeah.
too deep of a hole, and they didn't have the thought. The medical professionals didn't have the professional thought to do a skin graft so that
Mm.
I wouldn't be leaned over and hunched
Gosh.
over because of this, stretched out skin on my
Yeah, that
hip.
can help your back.
No, exactly. Yeah, and then, being 13, right, 12 or 13, I forget how old I exactly was. Had a huge growth spurt, and my spine just twisted up to kind of
Oh,
compensate for having less skin on one half of my body. So
Man.
it ended up curving and rotating everything. Well, it was that we didn't realize it until it started getting pretty bad.
Mhm.
Um, and we went back to Kaiser, because we were under Kaiser at the time. My mom and I, we went back to Kaiser, and the doctor immediately was like, "Oh, well, first of all, it's not our problem. We didn't have any,
Of course.
yeah, we didn't. It wasn't, us. We didn't cause that.
Yeah.
It just happens, right? A
Yeah.
really severe spinal, curvature
Mhm.
just happens. Okay,
Yeah.
so,
Of course, you're gonna say that.
yeah, and then their first thoughts were immediately into, well, it's gonna just have to be surgery. It's the only answer we could do to this. Just gonna have to be surgery. Just go in,
Yep.
bring him under the knife again, and
Yep.
immediately, like, my distrust, my trust for doctors immediately just went right through the floor at that moment.
Yeah.
Um, and then, did try to do a bunch of other methods and braces and stuff to try to fix it, and it did, yes, and end up having to be done surgically, and luckily that was through Shriners, which I will say is a great, they're a great
Oh,
organization.
nice.
They put me up in a hospital and uh, corrected it, and then they also had gotten infected, because I was, best way I could describe it is living in Hawaii at the time, because that's where I grew up. So you're in a tropical environment, and it's a 17-inch long incision.
Wow.
It's probably going to get infected. So luckily, sadly there was an infection, and so one surgery turned into 5, and being
Others.
stuck for a month in a hospital. But luckily that was
Okay.
under Shriners, and they covered all of it. So there was that, which luckily helped me out a little bit. But then, growing up even more, and I mean, that helped my trust in doctors grow. But
Yeah.
growing up and then seeing just what they do, it just starts going down and down and down. And I don't have a primary care physician, right?
Mhm.
I didn't, like, I have medical insurance, right? But I don't have, like, my doctor, because I don't have that trust there.
Yeah.
And I don't like going to the doctor. I've had many bad medical problems that I just, screw it. We'll just dust it off and
I hear
continue
you.
on. That I probably should get checked out, but I can't. I don't. Yeah,
Yeah.
I'm
I
permanently
avoid them
stuck with
too.
a bad decision. Yeah.
Yeah. We talk about the doctor-patient relationship here a
Oh
lot,
yeah.
anyways.
Okay.
But so we'll revisit this even more.
Yeah.
But yeah. But this was about the psychological effect on medical
Oh yeah.
professionals, and so considering
And
that you were thinking about being an EMT, that kind
yeah,
of
and
applies,
the
right?
psychological effect on medical professionals. We're talking about that and everything. I mean, I can only just, how completely removed
Mhm.
from your Hippocratic oath and
Yeah.
your wanting to be, like, talking with doctors and having doctor friends, stuff like that. And they they have this, they want to help. They really want to help people, and they really want to just, fix problems that people have, right? Like, you know, I'm an aircraft mechanic, right? I see the airplane and I go, all right, what's the problem? How do we get this thing back up in the air? How do we get it flying? Well, I mean, talking with them, they're the exact same thing, right? They have someone comes in the door, they have a
Yeah.
problem. How do we correct the problem to where they can live a happy life?
Yeah.
How can we correct it to where they can walk out the door and do everything that they wanted to, do everything they wanted to do? How disassociated with that do you have to be to literally just start chopping up babies?
Yeah.
Like how
Well,
completely
yeah,
removed?
you look at some of the medical textbooks, they're taught, that it has no value and that removing it has all these
Yeah,
benefits, and that's all, and they're left with very little information. So I can understand it to a certain extent, but at the same time, you have to, they're clearly numbing themselves to the the empathy or
exactly.
between them and who they're cutting.
And
So
it goes to that where talk about that has no medical value and stuff like that. How also, and I'm just grilling them. Is how lacking in how lacking in medical knowledge and stuff do you also just have to be to not also draw the line of, well, if it has no medical value, um why, if it has no medical value, just remove it. Well, then why aren't you saying that about anything else? How lacking in medical knowledge do you have to be, and how lacking in just common sense do you have to be of, oh, well, why don't we just start removing everything else if it has no medical value? Like, but not draw the line between that and circumcision, right? If the foreskin has no medical value, and you're removing it, why not remove? Again, like we talked about toenails, fingernails, whatever, right? But if you can't draw the lines between that, then I don't know how you're a doctor.
yeah. Yeah, I'd totally be fine with not having toenails to, clip. And,
Honestly, yeah.
yeah.
I keep stubbing them, and they just
Yeah.
I keep chipping them or dropping things, and they crack and it hurts. It's dumb.
I dropped a jack on one big toe
Oh
one time,
no.
and blood built up underneath the toenail, and it hurt like crap. And I got up in the middle of the night, and my dad had to take a hot needle and poke it so
Oh.
blood would come loose.
Oh. Yeah, I've had to do that once with my thumb. I accidentally jammed it with a screw gun. It completely punched through what I was trying to screw into, and it
Ooh.
slammed my thumb. And my manager comes over. He's like, "Oh, yeah, take a hot needle to that." And I'm like, "I can't."
Yeah.
Like,
Yep. Yeah. Exactly. So, anyways, that's the medical professionals' psychological effects. The parent psychological effects. Of course, it's going to depend on the parent and how they see this and all that. But I see parents psychologically affected whether they're defending the practice or not. Right?
Yeah, I have the same kind of thing with that with doctors to that. I mean, what we talked about earlier is, as a parent, how can you immediately offer up your baby to have something cut off?
Appeal to the authority of doctors.
Exactly,
Right?
right?
Or your religion, or your religion.
Yeah,
And your society.
yeah, and I do have to say, when it comes to religion stuff like that, I'm really glad that in Israel it's actually starting to become not common, and then in Jewish faith itself,
Brit
the
Shalom.
the Brit Shalom, where they're celebrating the life of the baby and not
No kidding.
chopping off a bit of the baby. Like, how can you celebrate life of the baby and then chop off a chunk of it? Like, how does, right?
Yeah.
Where are the lines with that? But yeah,
Yeah.
it goes to parents as well, as is how can you have something that's beautiful and perfect coming into this world and then immediately go, oh, it's not perfect because it's a boy, there's something wrong, right? How, if we are perfect and beautiful when we come into this world, right, barring also, no huge medical problems, right? If you're born and you're normal and you're fine, like you're all intact, what's wrong with that? How is that broken? How does that immediately need medical attention? Something's.
It's a source for infection. It's going to get infected. It's going to kill him. It's going to strangle him.
Yeah. And it goes also to, as a parent, right? And it goes also to, right, if you're thinking that with boys, right? Well, I mean, I grew up in a household with girls, right? I mean, UTIs, all that stuff. I mean, it just happens. And what do you do if you're a girl, right? If you have a daughter who has a UTI, what do you do? Do you
Oh,
start
God.
immediately going, oh, how much can we cut out of there to prevent
Chop off
this?
that
No,
labia.
you go, oh yes, antibiotics exist because we're in a modern society.
Yeah.
Who'd have thunk?
And do a better job of keeping her clean.
Exactly.
Yeah.
Right.
Not
And you don't,
super, you know,
yeah, you don't
sciencey.
immediately go in there and just start, we got to cut more things out to
Yeah.
prevent this. That's,
Yeah.
and so why, how, as a parent, can you have a daughter and not think that at all, and then immediately have a son and go,
I
yes,
I understand because I came this close to becoming a regret parent myself.
yeah,
I believed, I believed that there had to be a good reason for it. Otherwise, they wouldn't be
yeah,
doing it. Until some of the information was presented to me, and I was like, well, Europe doesn't do it, and they don't have
yeah,
these problems with STDs or whatever, and most of the world doesn't do it. It's mostly
yeah,
just the U.S. And then you start looking at the history. It's like how it got stuck in the U.S. And
yeah,
I realized it's like, well, it's kind of stuck here in the U.S. compared to other countries because here in the U.S. it's a fee for service
yeah.
system. Is it's capitalistic instead of social medicine.
That
So
really, I mean, with talking to some parents and on online and stuff like that, and trying to, and for the most part, I've been very successful on opening their eyes and convincing them that intact is, leaving your child alone, dropping the knife and stepping away from the child, as Penn and Teller would say it,
yeah.
is the best option. And um, they get, I mean, when I bring up the topics on, Henry Kellogg, and that he also, when it came to girls, was talking about putting sulfuric acid on the
Mhm.
clitoris of baby
Yep.
girls to prevent them. Like,
Yeah.
it was the same
Exactly.
man that said that convinced
Mhm.
circumcision to be a thing. And so, if you're, how can you shop into that? And
Yeah.
it's the also when it comes to talking about about hospitals and their fee for service and stuff like that. If I was looking it up, an infant foreskin roughly goes for about like $100,000. The hospitals can flip it for
Mhm.
$100,000 to, you have beauty agent, you have the cosmetics companies, and that
Yep.
really just starts, like, it blows their mind. They're just completely just uh like, at that point the jaws hit the floor and they're just like, tell me more, like, what's going on here, right? How deep does the rabbit hole go,
Yeah.
right?
Yeah. Look up
And
Sandra Bullock penis facial.
yeah, exactly. That's a thing. That is a
or
legit as disgusting, as horrific as it sounds.
yeah,
It is
or
true. That is a thing that they're doing.
Oprah and Skin Medica.
Exactly. Like some
Yeah.
crazy, weird. Because like it was going around there for a while. My coworkers were talking about they're like, oh yeah, you got to Google what cornflakes was invented for, right? So they Google that and go, oh, that's ridiculous. But
Or
then they
graham
don't
crackers.
exactly, and then they don't take literally. It's like the next door over. They don't step into that same Henry Kellogg building of stupidity. They don't go the next book over in the library and go, oh, wait a minute. We think this guy's a freaking loon for talking about how cornflakes and graham crackers are going to prevent masturbation, and we think he's a loon for that. Then we immediately don't go over to oh wow, this guy actually thinks that it was the guy pushing for circumcision.
Yeah.
Like, how
Mhm. Yeah.
it's
Yeah. So I don't imagine you're a parent yet, right, Kyle?
no,
No. Okay.
kind of luckily.
You probably don't relate to the psychological aspect as much. I mean, since I came this close to becoming a very good parent myself, I sometimes think about it. It just makes me sick to think that I would have let that happen to
Yeah.
my children.
And I can I yeah I can see that. And I mean, when it comes to my own parents, again, like, I haven't talked to them for over a year now. I've both blocked their numbers and
Wow.
all that. And I mean,
Dang.
with my dad, just because of how he was severely narcissistic and all that stuff,
Mhm.
I did. I mean, last time I talked to them, I did basically just say, I mean, this is the last time you're going to hear my voice. Is there anything you want to say? And he started going off on a whole thing of like why I'm wrong and da 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 da,
Mhm.
right. And I just was like, I again I stayed true to my word. I was like, when I said this is the last time you hear my voice, what
Yeah.
do you have to say? And he started going off. I just hit end
Being
call and
defensive.
immediately blocked the number. That is the last thing you heard from me.
Yeah, I'm
And
sorry.
I don't know. I don't know if I'll ever start talking to them again or what, but I have been so far living my life completely without them.
Yeah, I hear you.
No, I've cut all ties.
Yeah. Yeah, my dad got a little defensive, but you know, when I was telling him, I was straight up, you know, I'm not here to blame you.
Yeah,
I'm here to try to protect my nephew.
yeah.
So,
I guess I can't. For some reason, I can't. I guess excuse the logic or excuse
yeah,
the logical connection, I guess, whatever between you know you know, having a girl and leaving it intact and leaving her fine, and then having a son and immediately, right? And then I
you're
can't, yeah,
you're not alone. Yeah, there's guys out there that think that even regret parents that are intactivists
yeah,
should go serve time in prison. It's like,
yeah,
well, kind of they are.
true,
It's not behind physical bars, but they are serving time when they're spending lots of time trying to save the next generation. And I'd
yeah.
rather see them doing that than sitting behind bars, not able to do anything at all.
And then I guess, I mean, also when it comes to, serving time and stuff like that, it's knowing that you have harmfully affected your child, your offspring,
Yeah.
and that child has to live the rest of their life with the only body they have with a horrible decision that you made as a parent.
Yeah. And, you know, I think I've said this before in another interview, but if I was a regret parent, I would literally go turn myself in
Mm-hmm.
just because I want to see it go through the courts.
Yes.
I want the courts to prove that it is not illegal.
Yes.
Because there's no law
And
that gives this an exception to sexual battery of a
yeah,
minor.
there's no exception to that. Like it's and was it just recently that they busted a guy, and I think in New York or whatever, who was trying to smuggle his daughter to go get her circumcised, and they threw the book at him.
Hmm.
But
Yeah, I guess there's
no,
one in Texas
yeah,
that just popped up recently too.
yeah,
A woman went, took her daughter, whatever. Yeah. Yep.
yeah,
So, yes, FGM happens to
yep,
children in the United States, or
yep. And the same legal system with FGM should happen to MGM as well.
yeah, equal protection.
Yep.
Can't protect one group without protecting the other. Yeah, but we have to somehow get them to realize that yes, it is harmful, to cut
Yeah.
boys too. So. Okay, so and then the last one here is the psychological effect on intact men. Uh, you know intact men, right?
Yeah. Oh yeah.
You've
I've
talked to intact men about this.
oh yeah. Like I talked to my roommate, like I was saying with him, like he's
Yeah.
just completely mortified
Hmm.
about all the ins and outs and what it does.
Yeah.
And yeah, shocked of
So even though he's not cut himself, he is
yeah,
psychologically affected by the fact that this ritual,
exactly. Yeah.
cultural ritual of cutting children is going on in the world.
Yeah.
Yeah. Yeah, it's one thing when the cutting is happening across the ocean or whatever.
Yeah.
It's not in your own culture, but when it's happening, in your own backyard, uh, yeah,
It's yeah.
it's
It's
it might be
kind of
happening
like,
behind
oh, that's
closed doors, but yeah,
yeah.
still very hard to deal with. Okay, the next section is about relationships. You've already addressed this multiple times.
Oh yeah.
Child-parent trust. It doesn't sound like you trust your parents, especially
Not at
right
all.
now.
Yeah.
You don't even want to talk to them.
It's yeah, I don't I just I for some reason, I mean, as I see it, and I've convinced myself and everything, there's no excuse,
Hmm.
right? There's no excuse for what they did
Yeah,
and how like horrible of a thing that was done.
yeah,
And it's yeah, it's I can't I don't know. It has completely tarnished my relationship with them.
I understand, man. As a dad, I would want my son to keep trying
Yeah.
to talk to me. I don't know what your dad is exactly like. You told me a little bit, but yeah,
Yeah.
trust with my children is very important to me. I want my children to trust me. I want them to be able to tell me whatever is going on in their mind without being worried that I'm going to attack them or verbally abuse them or talk
Yeah.
down to them or whatever. I know that I do that to a certain extent, anyways. But I try to talk things through with them to
Yeah.
make sure that they understand my position and make sure they're okay with that they got the lesson or whatever, got through it.
Yeah. And there's, I mean, I do understand also. I mean, as I have a lot of friends that are parents and all that stuff, and talk with them, and I always also just seem to get along with older people a lot well, and talking with them, and just understanding that being a parent and being an adult, it's there's no there's no immediate switch where you have all the answers and everything. I mean, you're a grown-up kid. That's
Yep.
just what happens, right?
Yeah.
You don't
Yeah. There's
you
no
just
real line.
There's no real line. You just
Yeah.
kind of keep making it as you go every day. You're just
Yeah.
trying to figure out what's going on. And I mean, and I understand that as parents and stuff like that, there's a lot of, as an adult, even, you just have a lot of trust in people to do the right thing that end up not doing the right thing or leading you down the right way or stuff like that.
How,
And yeah.
how do you feel towards Andrew, the doctor on American Circumcision
That
Jewish?
circumcised his own son.
Yeah,
Yeah, I
on the dining table or whatever.
yeah, I can
Yeah. How do you feel about him?
I am just so I don't man, like again, like I said, I respect all religions and I love studying all religions. I have a lot of Jewish friends, and I've literally am like, I'm like, all right, can you invite me over to your next, the next religious study, all that stuff you have? My I go to my one of my coworkers used to go to church with him and all that stuff. I'd kind of invited myself. I'm like, hey, next time you're doing that, right? And I love studying on it, and I love seeing all the
Yeah.
cultures of religions and stuff like that as well. But
Yeah.
when your religion ends up to the point of you're harming someone else, I don't care if it's your own child or what, it is still, again, another human being.
Yeah.
I can't get behind that part, right?
Yeah.
I can get behind, I can get behind the dietary stuff. I can get behind
Mm-hmm.
the certain medical things, right? But I can't get behind the medical aspects of directly harming your child,
Yeah.
like circumcision, or
Yeah.
when it
But
comes,
they think that it's not harming.
yeah,
So that's the tough piece.
that's the
Is
tough part,
you
is
have to
trying
get
to
through to them that it is
yeah.
harming.
I mean, it goes along the same lines, right? And it's not just Judaism that does things like that. I mean, you have like uh oh, what is it? Is it man, why am I blanking on this? It's Church of no, it's the oh man, they come to your door, not
The
Mormon,
Mennonites.
no, not Mennonites, it's
Oh, yeah. Jehovah's Witness.
Jehovah's Witnesses. There you
Yeah.
go, right? And not getting blood transfusions,
Yeah.
right? Your child, like, it's the same kind of line. Your child is bleeding out on the table. Like, you've gotten in a horrible car accident, your child's bleeding out of the table. They are going to die if they
Yeah.
do not get blood, but you're going to refuse that.
Yeah.
You're going to kill your child, right?
Yeah.
And it's that same kind of thing, right? You're going to have a bris for your child, right? You're going to actively harm them.
Yeah.
That's where I draw the line. That's where I'm like, you can't, don't do this, right? That's you. I can't. And I get it, right? Because he was also talking about tribes and things like that,
Mm-hmm.
right?
Yep.
This is your culture. This is your tribe.
Yeah.
Hey, man, I hate to sound all like, millennially or Gen I or Y or whatever the '96 period is, right? But it's the modern times, man.
Yeah.
You gotta
Well,
realize that.
we're social animals, and
Yeah.
the fear of being outcast. This is something I faced myself before I
Yeah.
started speaking out publicly. Right up to the point of the beginning of 2018, when I first wrote my first blog about this, I was a little worried. I was worried for my job. I was worried for my family,
Yeah.
and but it uh, what won out was the thought of the children, the next generation.
Yeah.
I had the thought that, in 15, 16, 17, 18 years from today, I'm going to run into someone that is going to be mad that they got cut.
Yeah.
And they're going to like, well, what were you doing, 15, 16, 17, 18 years ago? I had to be able to say that I was doing something to try to protect you.
Exactly. We it's the, it's the same kind of thing of like the people that marched across the bridge with Martin Luther King and the people who did the sit-ins at the restaurants, right? They were sociologically or societally at the time. They were in the wrong there, right?
Yeah.
How can you? We've had this culture of only whites sitting at this restaurant for years, and
Mhm.
this segregation and all that stuff. But like, you fast forward 60 years, and it's those people sitting down in that restaurant were in the right there, because the
Yeah.
societal things were in the wrong, right? That whole culture, we see it now as it was in the wrong.
Yeah.
They
Those people that spoke out, they were taking risks.
they were taking risks, and they
yeah.
made the future a better place.
They did. Yeah. Yep. And we just need more people to think like that and see that side of it.
Yeah.
Unfortunately, people like your parents just don't see that yet.
Yeah.
And I took I feel a little embarrassed that it took me a dozen years, but yeah, I look back and it's like a lot of those years was just going through the grief over and over and over again as I was learning the harms, and
Yeah.
I just kind of I was processing things. I'm not extroverted, but introverted,
Yeah.
right? So
Yeah.
I process things internally instead of talking a lot about it, and that's what I was doing during those years. I was focusing on work and kind of keeping my head out. It's kind of funny. My wife got very active in the intactivist movement, and I was staying back. And then around the time that I started getting into it, she was getting burnt out. So here we are today.
Get a tag team.
Yeah, kind of. I want to talk about it or whatever, and she just can't. She just it's too hard for her to deal with, especially. I mean, sometimes I'll come across a video like on Brother K's page or whatever that you hear the baby screaming, like she
Yeah.
loses it. She just can't handle it, and
I
I get it.
Yeah, I had to skip through that part on American Circumcision,
Yeah.
and I just can't, because it's just so
Yeah,
disgusting.
I've been talking about and Brendan Morelli knows that I suggested this, but I've been talking about making an edit of his show that excludes any video of the baby at all,
Yeah.
right? Because right at the very beginning, you see the baby,
Yeah.
and you already know what's going to happen to it,
Exactly.
right? Especially us intactivists, we know, and we hate that, right?
Yeah.
Whereas people that aren't already, pro genital autonomy, they're not. They're just thinking, "Oh, cute baby," and they're,
Yeah.
Brendan was very thoughtful about how he put this together. He
Yeah.
he he made he created he had this person in front of everyone, nice big up on the screen, right? And people start feeling for this person,
Yeah.
and then it gets to the point where the person gets part of their genitals cut, and that triggers them, and that wakes them up to how bad this this thing is. So it was really brilliantly put together, but certain people will not watch it because they can't stand the idea of what happens.
Yeah.
So
And
it would be
that's
really nice to just have an edit that just includes the talking points, the back and
yeah.
forth.
Yeah. Like, I mean, I sent the video. Sent back when it was on Netflix, American Circumcision. I sent the link to both my parents, and I talked to my dad and my mom about watching it afterwards and everything, and they're like, oh, we couldn't, we had to, I had to turn it off at the circumcision scene. I'm like, oh, okay, so you had to turn it off there, and you couldn't watch that, you couldn't handle that because it was just too awful.
Yeah.
But you did it anyway. Okay.
Yeah, you did it. You
Like,
did it to me.
yeah, you did it to me,
So
right?
obviously you think that's horrible.
You
So
think it's
can I get
horrible
an
and
apology
disgusting and
now?
can't watch it. Yeah, exactly.
It's like if you think that that was horrible for that baby, then obviously you thought it was horrible that it was done to me, right?
Yeah.
Yeah.
Yeah, it's I don't know.
Yeah, I would be interested to like do a survey to find out how many people did turn it off, stop the video before then, and didn't
Yeah,
watch the rest of the show.
because I can get through. Like I had to pause it. It was like that first shriek, and I immediately was like, nope, click.
Yeah, I hear you. Okay, so that was child parent trust. Co-parenting. You're not a parent yet. But the whole idea is that with co-parenting, well, a lot of people actually end up in divorces just because of this issue, because they butt heads about cut or not cut, right?
Yeah.
Jessica and
They
James Rigdon are an example of that, where they really butted heads about this topic.
about the oh yeah to whether to cut the child or not cut the child. Yeah, it's I mean if someone, again, that also goes into the, like, morally wise, if you cannot if you don't see the moral um, the wrongness with hurting a child, then there's something wrong.
Yeah.
Right? And it goes into my thing about whole, right, that we are, I mean, based down deep inside of us, right? We may think we're, very smart and wonderful beings and da 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 da, right? But we still have this innate monkey brain, this very, very basic instinct of we must protect our we must protect our young, we must replicate, right? We must reproduce, we must protect the offspring so that they can also grow up and reproduce to create this, to keep our species going, right? That is our innate guttural, like, deep down base spine instinct, or base of the brain instinct. To immediately throw that out the window and go, no, harm the child, right? How? How something has to be wrong.
Again, people don't think that's harmful, and they think that they're doing something for the
Exactly.
child.
They get, yeah, and
so that's our challenge as intactivists,
exactly,
as
and
genital autonomy advocates, is to wake people up to the fact that it is harmful.
yes, and the people that end up seeing all the evidence and seeing everything piled on top of how, what harm it does, and all the terrible things that are the again, that one step forward to end up having to take 20,000 steps back on, the risk to reward, to the people who have all that evidence piled in front of them, and immediately go back to, no, cut up the child. That's something that's where we go into, there has to be something wrong there, right? How no person in their right mind would voluntarily harm a child.
I don't think so either.
So to when it comes to that partner thing of people in relationships and ending up, you're going to have a boy and stuff like that, and all of the all that whole, conversation about having having the child circumcised. And if one person, if one parent wants their child, I mean, I guess it would be an intactivist, but one parent is just a normal parent who wants to have their perfect child, right? Have their whole child and have the child experience their whole body. And then the other parent wants to circumcise, and that one parent, the parent that wants their child intact, provides all the information, and with the wealth of knowledge that's on the internet now and everything,
Hmm.
but that other parent wants to still circumcise,
Yeah.
then again, something is
Yeah.
wrong.
I don't know if you follow much on the Your Whole Baby community group on Facebook, but there's quite often women that come along that say, my husband wants to cut and I don't want to.
Yeah.
And they don't know how to convince the husband.
And yeah, it's again, the best thing I could say, if people want to convince their spouse of keeping
Mhm.
their whole baby, is the plethora of knowledge. I
Yep.
mean,
Yeah.
you have Catholicism and Christianity. If it's a religious aspect, there's verses in the Bible, and there's stories in the religious text and everything that tell you to keep your whole child. I mean,
Yeah.
and same thing with all religions, right? All religions have an aspect of the we are created perfectly, right? We are created, then why, if we were created so perfectly, why go through and mess that up? Why immediately find fault in a healthy, normal baby child just because it has a penis?
Yeah. Yep. For sure. Okay, the next thing is the mother-child bond, and we talked a little bit about that before. It sounded like you were in a factory hospital.
Yeah, I was yeah, whatever uh, sadly the building's, I mean, kind of luckily the building's not there anymore. It's been turned into, or no, it was storage, and then I think they built something on top of it,
Mm,
or Kaiser built a computer center on top of it.
mm,
But yeah, that sh- that whole thing, I wanted to, I mean, finding out about this and everything, I was like, I'm gonna burn it down, right? And I'm gonna go there and I'm gonna try to find everything, and it's, you know, that whole thing of that just completely threw out the window, right?
yeah.
It that crumbling down of relationships and trust for parents or mothers
Yeah.
or whoever, immediately just crumbled.
Hmm. Yeah. So we don't even know whether you have been able to bond very well with your mother,
No,
even if you weren't getting your
yeah,
penis mutilated.
dissected, mutilated. Yeah,
Yeah.
I
But
don't think. I
it's something
mean,
that's often talked about. My wife actually learned how to be a doula. She
mhm.
actually attended like 5 births,
Oh wow,
including her own too, obviously. Um, but the skin to skin contact right after birth and stuff like that
yeah,
is considered very important. All that, and
mm,
breastfeeding is a big
completely.
deal. And those kind of things are interrupted
Yeah, it's
by doing this, especially if they try to cut you within the first
yeah,
hour or days or
24
weeks.
damn hours. I'm like,
Yeah.
it's really blew my mind. Like, I was whisked away, right? So I when I was born, my I think I was born like basically on schedule, but they thought I was going to be a little late, um, and so they had, got my mom all ready, and you know got her set up and pumped up with some stuff to try to ease me out, and then they were like, all right, well, looks like it's not happening, so we'll come back in a little bit, and that was a long bit that they weren't going to be back for, and a little bit after that, after they had already left, was when I decided I was going to show up, and
Mm.
so it was my mom and my aunt were there in the hospital, and my my mom turns to my aunt. How she described it was, my mom turned to my aunt, was like, "You need to catch him." What? You need to catch him now. Oh, I don't think I can do that. My mom's like, you pull calves, you can catch a baby, right? You can, if you can catch a cow, you can catch a human baby,
Yeah, for
right?
sure.
And so my aunt was trying to call the doctors. Doctors never came over, and I mean, that should have been the
Mhm.
first warning sign about that whole, how much they care.
Yeah.
So my aunt had to wheel a cart in and like caught me as I was coming out, and I flopped into the cart basically. And my dad had came in, saw me there, immediately fainted, and yep. And so then right after that they're like, oh well, all right, well he's jaundiced, so they got to whisk him away, and that was where I was like, no, I don't think I had any contact with my mom. So
my oldest was jaundiced, but it's like, no, in the morning, take him out and get him some sunshine.
sorry, say again. My roommate knocked on my door.
No,
Was that?
my oldest was jaundiced, but
Ah.
they were like, yeah, just in the morning when we have sunshine, take him outside and get him some sunshine. It went away.
That's nice. That's the hope that's a good progression in the medical society.
Yeah.
Just that,
This was a midwife. My
Okay.
wife decided to change to an at-home birth, and actually
Nice.
a water birth too. But after my two sons, I look at birth at hospitals and think, it's kind of like sitting on a toilet and having several people around you telling you push. It's like,
yeah.
that kind of makes things not work right, because you get stressed out and you kind of tighten your sphincter, not release it.
It's like I had to go in and get some imaging done on my esophagus or something. So you have to drink that like fluid that shows up and all that stuff. And then after that, the doctor's like, all right, well, you can't leave the hospital till you got to pee it all out. And I'm like, all right,
wow.
well, and well, man, having a bunch of doctors waiting around for you to do something, that natural bodily function of going pee or going poo, having a baby doesn't happen.
Stress is not what you want in situations like that.
Yeah, I don't care how comfortable they make it with, all that. Nope, it doesn't happen. So yeah, seeing it could be hospital's probably not the best place,
Yeah, not to mention the other germs running around and all that stuff too.
But,
yeah. Anyways, I had another discussion too. So do you have any thoughts about bonding with your mom? Do you think that that's had any effect on you bonding with your mom?
I mean, I always think about it, maybe talking to her or something, and then that immediately is drowned out immediately by the thought of what I've kind of, I guess, made in my mind is that she lied to me for 20 odd years. 24 now. She lied to me for 24 years, right? I just keep going back to, if she says that she loves me, and that I was I was her only, and I was her. So she had just my sister and I, and so she had always called me her favorite son, and that she always loved me and all that stuff, right? If she said all that, then how immediately when I was born could she have made the decision to, as I see it, throw me away? How can you immediately have something
for doing good for you?
Yeah. It's just, I can't, for some reason I can't wrap my head around that, and so for that reason I'm
it's really hard to be in those kind of shoes, right? I mean, it was a different time and all that, so
yeah. And it goes for the mother bond relationship and the father bond relationship too. Like with my dad, I can't trust him. I can't, if he said he loved me and all that stuff, well, cool, but why did, and then it goes to the, if you had heard that maybe it's actually a good thing, why did you say to leave it extra and do it freehand? You should have, if you were on the fence about it, which, I mean, it was during 96. So if I remember reading up correctly, I think that was one of the years, because it's like every 5 years or so, the American Pediatric Association starts flip-flopping on the issue. Right? And that was one of those years. If that was such a thing, why you don't need to immediately do it after I was born. You could wait. You could wait and read up on it some more and all that stuff. So it doesn't immediately need to be done. And you could have thought about the whole thing. Because my mom, so when I was, one of my cousins was born about, it was like 4-5 years prior to when I was born, and he was born. I was like 3-4 years before I was born, and he kind of, I guess, probably on the spectrum a little bit. So because he really didn't start speaking till he was like like 4, getting words out and stuff,
Mhm.
and he had always, because I was talking to my mom about it, she was talking about how he had always been, grabbing at and grabbing it and tearing at his penis, and that they had only realized, it was like immediately after I was born, they had only realized at that point then, because he had started forming words and everything, that they had just botched up, you know, just
Mm,
ruined up his circumcision and caused him to have like adhesions and
Discomfort.
all that stuff,
Yeah.
and discomfort. And it was at that point that my mom had told me that if they had learned that he had a problem with his circumcision, then they wouldn't have circumcised me.
mm. Well, too late.
So
Too little, too late.
I know, too little, too late, right? You can't reattach something that was cut off.
No.
Yeah, it's off.
Yeah. There's a gift that goes around of Jack Black saying, "You take it off, you can't put it back on."
Yeah.
Yeah.
Right? And I'm sorry to kind of sidetrack a little bit, but I'm looking forward to. Hopefully, I have a lot of faith and hope in 4Gen, with
Hmm.
what the work they're doing, and I always gives me a little hope, right? And I read up the story on the soldier that had gotten blown up and had amputated his penis, and they had basically built and the same kind of stuff that Fortune's trying to do. They had basically regrew a penis for him and all that stuff, and I'm like, wow, if that could actually be a thing, right? And
Yeah.
if the hospitals are all about profit and making money and all that stuff, man, there is an untapped wealth that could be made off of
Yeah.
reattaching and regrowing with their own, you know,
I
their own
just wonder about how
cells.
they deal with the nerves and all that stuff too. But
Exactly.
yeah, hopefully we'll figure something out. I mean,
And that, yeah,
bioengineering.
yeah, and that caused me to also deep like research into things, and I guess my mechanical nature and knowledge, and I guess just of there there has to be a way to fix this item, right?
Mhm.
Because I started diving down that when it came to how can I fix this, right? Because it was around when I was like 20, I was like, screw it, I need to start putting things back together. And it was around 15 actually when I started learning about circumcision. Was one of the first websites that I'd researched was of oh man, it's the guy that makes the DTR tugger.
Oh, yeah, run low.
Yeah,
DLC Tugger.
TLC Tugger.
Yeah.
Yeah, that guy. Yeah, I'd stumbled across his website. It was one of the first ones
Hmm.
went to when I was researching
Yeah.
just circumcision. When
Did you ever
I
see
was
his
like,
video on Howard Stern?
I have, yes, the that was wild.
Yeah.
I love that whole yeah, that no censoring, no nothing there.
Nope.
We're just gonna go full into the topic. But
Yeah.
yeah, so I'd started researching that, and I've always had wanted to do that and get my foreskin back, and now as an adult, right, and making money, I one of the first purchases I bought with my paycheck from working getting after I got this career was the one of the tuggers, and
Hmm.
gotten set up on that, and
Okay.
like because I had researched into that, and I wanted to do that, and then I found out that there's kind of some like very kind of new medical fields of also looking at into surgically restoring, right?
Hmm.
If you
Yeah.
can,
The book I showed you from Jay Jackson, he did
yeah,
some surgical
yeah, because I'd figured out about
stuff.
there's the coin purse method and the other one where they basically tried to create a pseudo rigid band,
Hmm.
um, and all that stuff. And I had looked into that, and then luckily with the nerves, right? Talk about the nerves. I had stumbled across some research from like the 80s on trying to regrow the Meissner's corpuscles, those
Oh,
very fine touch nerves.
neat.
And it was on some obscure thing. I gotta find the links for it and
How,
everything and post it
if,
up.
my thinking is that if they are able to, if they figure out ways to grow nerves, then they can figure out how to fix like broken backs.
Yeah, they
You
can.
know?
It's the same kind of thing. You got to get those fine touch nerves and all that
Yeah.
to reconnecting. Because I mean, it's very simple mechanics, right? The body is just a meat robot, right?
Hmm.
Where
Yeah.
a
Exactly.
bunch of electronics, synapses firing off in all these different locations. So how do you reattach those synapses? How do you get those
Yeah.
or create receptors for those synapses? And I'll post it up somewhere, but it was this link. They were regrowing Meissner's corpuscles by doing injections
Oh.
um, of I think tissue that already has corpuscles in it,
Hmm.
and the body would basically just start going, okay, this is what we need to have here. Start reproducing it, and would you
Huh.
know start cultivating a
Wow.
Meissner corpuscle farm.
Yeah. Well, yeah. If we could just figure out, I mean, how to grow babies in
Yeah,
petri dishes, and I know they're growing skin already in petri dishes. It just
exactly.
I don't know that that skin grows with nerves, but I don't know. I'm sure
Yeah,
they'll figure something out soon enough. It just still sucks that we have to go through it to fix ourselves, but
exactly. Right. One thing that takes 9 months to
yeah,
grow and take care of, right? And you're making sure not to smoke or drink because you have a baby that you're trying to take good care of, right? Watching what you're eating, and then you pop the thing out, and within 24 hours you want a chunk of it ripped off.
yeah, yeah. Much easier to just not cut it.
Exactly.
Okay, the next part about relationships is about pedophilia.
Hmm.
So there's some thoughts about how this genital cutting, you know, all across the board, and not being specific about males, but
Yeah.
female genital cutting, intersex genital cutting, all across the world, uh, contributes to pedophilia.
I'm gonna
I mean,
say
when
there
you look
has
at
to
it,
be. Yeah.
there's an interesting correlation that I talked about with another interview not too long ago, where when you look at child brides,
Hmm.
um, forced marriages of little girls, um, those are also cultures that cut genitals.
Hmm.
You don't find child brides in like South America or Russia,
Yeah.
right? It doesn't happen. So it's like interesting correlation. Maybe there is a connection here between pedophilia and genital cutting of
Yeah.
children.
I have to say I think that's I mean that's along the same lines of what I was talking about earlier with the whole there has to be something mentally disconnected if you are a doctor, whatever, and you're going to just all right, got to chop up the genitals, right? If that is your focus as a doctor for whatever you're
Yeah.
doing, there's a problem there. There is some sort, and you're not seeing any wrong with it, or not open to the thought of anything being
Yeah.
wrong with it. There is something wrong with that.
Did you see the
Right.
video where this older lady that was a doctor came across a bloodstained man and tried to argue with him?
I have not seen that
Okay.
one.
There's one I actually chopped up a lot of it and made a bunch of little videos on my TikTok
Yeah.
of her. Um, but yeah, it really shows how little she was taught about the prep use and how
Yeah.
convinced she was that she was doing something good for the boys. So she was definitely dealing with a deep cognitive dissonance when
Yeah.
talking to like James Rigdon and and Brother K and some
Yeah.
others.
Because it also goes on to like having a conversation with other parents and stuff like that that are really adamant about wanting to get their child cut and everything like that. And you see the posts again. Yeah, you see the poster of Brother K and all that stuff on the group, and they're like, the whole thing of, oh, I don't, the clips from people's Facebooks where they're like, oh, I don't want my son to have a turtleneck and I don't want his penis to look weird and all that stuff. It's a child. You shouldn't be
Yeah,
concerned with how a child's penis looks. there is a problem if you're concerned with the cosmetics of a baby penis.
Yeah, I don't know. It's like something gets stuck in people's heads when they think turtleneck. It's like, okay, the penis grows in and out, just like the turtleneck head goes in and out.
Yeah,
take the skin off the darn turtle's neck. What's going to happen?
Yeah, and I when talking with my mom about all the issues and stuff like that, and seeing the comparison side by side, of what it does, it was one of the how keratinization affects the glands. It was one of those photos, and I was talking to her, and she was like, "Well, I thought it always covered it. That's why it gets dirty and stuff like that." No, an erect penis looks almost exactly like a circumcised
it depends
penis,
on how much
right?
skin
It depends on how much
but
skin you have, but as long as you don't have phimosis, which is also another, that's always an excuse, but it's easily fixable with steroidal cream and stretching, as long as it's already been separated from the glands naturally, right? all prepubescent children have phimosis because that's a natural thing. It's connected.
You can't actually diagnose it.
Yeah, you can't
child.
diagnose it. Yeah, it's the foreskin is always attached, to the head of the penis until it naturally disconnects, right?
And if your child is saying that they have pain down there,
yeah,
well, what it probably is they're having an erection and they don't understand what that feeling is. It's not necessarily pain. They're having an erection or something like that. They get erections of whatever at times, and
it happens, right?
I mean, get a little tight and tug a little bit.
Yeah.
But unless they're tearing or something like that, they're fine.
Yeah. Again, unless there's a actual medical problem.
Yeah.
There, right? That requires, there you go, right? You don't treat something before it's before it's a problem, right? Yeah. There's preventative stuff, but there's no guessing on the preventativeness, right? Yeah, so it goes into that, right? That there's, wanting, when it comes to the pedophilia and stuff like that, there is a problem where there is a problem if you want your children to have, if you want your children to have good-looking genitals, right? I mean, we always want, as like as a parent, whatever, like that, I could see you want your children to look nice, right? Or you want your children to be, good-looking, right? But you shouldn't have you shouldn't. Sorry if I'm swearing. It gets me riled up on this.
I hear you.
You're not having genital beauty pageants, right? You're not trying to freaking make your kid have,
and beauty is
attractive.
In the eye of the beholder.
Yeah, and children's genitals shouldn't look attractive. They shouldn't be attractive to you. There is a problem if they are. So if you want to start, doing cosmetic surgery to make it look pretty, there's a problem.
There's this video. I took the little piece of it and stuck it on TikTok. This guy, he talks about walking into an art museum somewhere in Europe, and it's of all these statues of naked people or naked men. And he talks. He's a victim like you and I, and he talks about how beautiful they are.
Yeah.
With their intact genitals.
Yes.
I mean, really, for me, I found the preputially amputated one more and more disgusting as I've learned more and more about how it's supposed to work.
This horrid, scabbed over, scar tissued up, with all the weird, inner foreskin that's been dried out, looking leathery, right? That's not. That doesn't look appetizing. That does not look nice. That shouldn't. That looks bad, right? So, for some reason, though, you have this culture that is very attracted to the stump of a penis, which is preposterous. And then when it comes to like there being something wrong, there is something wrong where, again, if all the facts medically are laid out in front of you, right, and all the facts showing that there is no benefit to or the risks do outweigh any benefits that
Yeah.
you get from circumcision, right? And you still want to do it for cosmetic reasons, that is an issue when it
Yeah.
comes to there is something wrong where
Definitely.
you are worried about, again, the looks of a child's genitals.
Yeah.
Right?
Yeah.
It's along the same lines of like, you don't take your 14, 15-year-old daughter out to get breast augmentation.
Yeah,
That
I was just about to say that. I actually
yeah,
tweeted that today back at
you
someone that
did.
was talking about.
You're not gonna get your 15-year, 14-year-old daughter to go get some double D's. That's no,
Yeah.
that's wrong. And
Yeah.
if for some reason society, in the U.S. at least, for some reason, if society can see that that is something wrong, right? How can we not draw the lines that cutting up a baby boy's genitals for cosmetic purposes, right? And that excuse of, oh, he's gonna get made fun of in the locker room and all that stuff, right? Do we know that doesn't just we shouldn't be concerned about
Mhm.
the again the cosmetics of genitals of
Yeah.
our children's genitals in general,
Yeah.
right?
I hear you. So that was pedophilia. The next thing is doctor-patient relationship, and we've already talked about that a couple times.
Yeah.
Personally, I can't imagine having a doctor, um, going to a doctor that condones or promotes this. As far as I'm concerned,
Yeah.
if they can accept that, then what else can they
That's the same.
do
Yep.
that when it comes to taking care of me?
Exactly.
It's
If
just too
they
scary.
are, that goes to show that if they're willing to perform circumcisions and stuff like that, that they are willing to completely ignore any other knowledge about any other concern or problem, right? It's it's along the same lines, right? If your doctor's, reading from the books that say circumcision is good and all that stuff, then what other crazy Harvey Kellogg-ish style stuff is
Yeah.
he willing to believe? And if because he's not right to it's really simple to figure out that it's bad, that circumcision is bad, if you are willing to um, cross pollinate your resources. If you're willing to
Hmm.
expand your resources and which is simple to do, right? We
Yep.
have the internet now,
Yep.
right? If you're a doctor who is not willing to, peek out the window, right? Or just,
Mhm.
look at the next book over, the next thing over, right?
Yeah.
And see what other doctors are talking about. And if you're not willing to do that, and
Yeah.
so that way you're just, keeping on with circumcision and stuff like that, I can't trust a medical
Yeah.
professional that would be able to do that, because you don't know, again, yeah, what other crazy, weird, wackadoo, out of date stuff is he willing to believe?
Hmm. Yep. Yeah. Might decide to give me a lobotomy.
Exactly. Yeah. What is he gonna do? Yeah. Start electroshock therapy
Yeah.
and all that stuff. Like,
Yeah. 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 People appeal to the authority of doctors, but all you do is look at history and see how many
exactly.
times the medical industry has been dead wrong.
Yeah.
So
Like, what are they gonna start
question them.
doing? Breaking out Eye of Newt and whatever, all that stuff again?
Yeah.
Like, are we gonna
Yeah.
go back to like
Yeah,
it's
I haven't thought it would be fun to create a museum on the horrors of medicine.
yeah, the weird
Just
quackery that's made it through,
yeah,
right?
where you walk through and
Us,
you see in one room they're the wax museum where they're doing a lobotomy or
yeah. And
or
they're
another
going
room where
over,
they're doing bloodletting.
yeah. They're tepping or whatever, where they're cracking open skulls, right?
Yeah,
Yeah. Oh, you got the sniffles. Oh, looks like you need an inch hole in your head, right?
yeah,
It's the
exactly.
same kind of thing, right? Like, we're
Yeah,
not doing that, but for some reason we don't think that boys should have penises. Well, all right, or boys should
yeah.
have all their penises. Apparently, that's which,
Hmm.
yeah, that's along the same lines of that crazy wackadoo stuff
Yeah,
of bloodletting and you know, lobotomies and all that freaky stuff.
Yeah. Yeah. So the last thing on relationships is friends and family, and you said that you're already estranged from your parents
Yeah.
right now. Are you estranged from other family members?
No, I
and-
mean, our
or friends?
family's kind of been very split up in general, at least in general. I mean, I have an uncle on my dad's side, right? And I mean, we haven't hung out or visited or anything like that very much. Haven't seen him in person for 4 or 5 years now, right? It's a very loose knit family. Um, so I mean, I haven't had contact with anyone other than when it comes to my family, my sister. I mean,
Okay.
her and I, we get along, and she can't really put. I mean, she's really smart, but see, when it came out to like the kids, she was like the very book smart child, and I was the very street smart child, um, and so she can't really piece together why I don't want to speak to either of my parents or anything like that. Um, but I mean, she rolls along with it. We get along fine and all that stuff. But I mean, just recently, when I talked to her a couple days ago on the phone, she asked me at the end of our conversation. It was just, so when it comes to mom, are you just you're not going to talk to her for forever? And I'm just like, I was just, I don't know, for the foreseeable future. No,
Yeah.
I don't see myself ever talking to her ever again. But
Yeah.
yeah.
It's sad. I've seen, my family. Even I kind of feel like I'm a black sheep in my family, but because of this issue,
Yeah.
most primarily. Um, yeah, I've seen plenty of people lose friendships over this and get estranged from family members because of this.
Yeah.
So I just imagine a world where genital cutting wasn't a thing. Would there be something else that would cause such a rift in relationships? I don't know. I can't
Uh,
imagine anything else.
I mean, it goes along the same thing about what we were talking about earlier. Like, there's people, there is like a small group of people that have to take steps and do drastic things, like again sitting at a restaurant, right, and walking across the bridge and sitting in the front of the bus and all that stuff. There's certain things that the small group of people that the portion of society may see them as crazy, but
Hmm.
eventually people start waking up and realizing that, oh, maybe society needs to change.
Yeah. Well,
And
there's been plenty of cases in history where one person was thought of to be absolutely crazy or whatever, but they
oh yeah,
still ended up being right.
yeah,
Look at the guy that said, "Hey, the world is round, not flat," and look at the guy
exactly.
that came up with Ohm's law. You know,
Exactly, yeah. Then,
yeah,
or shoot, you look at the people that say, maybe again, yeah, teppening and bloodletting is not a good thing, right?
yeah,
Maybe there's a thing called germs.
yeah.
Right?
There's plenty of cases in medicine where someone came out saying something different than was not the popular opinion, but
Yeah,
they ended up being right, and and thankful. We need to be thankful to those crazy people.
yeah,
And we need to open our minds a little bit to the possibility that, hey, maybe they're right. Maybe we should investigate this a little bit.
exactly. That's and I'm hoping to see that with society as a general. I mean, we're in this very rapid transfer of knowledge stage now, right? We have the internet and everything like that, and
Yeah.
it's very, I don't know. It's led to both good and bad things where you have certain people that are just stuck in their ways and all that stuff, and not wanting to change anything,
Yeah.
and they're just making up stuff to go along with it. And I mean, luckily that's kind of slowly dying out, with a lot of the stuff that's posted in the group about parent groups on Facebook or whatever, trying to talk about, well, what should I do with my son, da, 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 right? And
Hmm.
the fact that there's actually more and more people coming out saying, no, 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 leave the
Yeah.
child alone, they're fine.
Yeah.
That.
Yep.
Yeah.
And don't forcefully retract.
Yes. Yes. Yeah. Don't. If you do leave them intact, don't do that. That would.
Yeah. No, you don't clean the inside of a vagina. You don't clean the inside of a foreskin.
Exactly.
Just clean what's seen. Yeah.
I do like the posts. Sorry, real quick. I do like the posts where it comes to like parents trying to talk about how, oh well, it's so much easier to clean if they're circumcised. Da 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 da. And you get like the mom or whatever that's like, well, I have an intact son, and you just wash it like a finger. You just
Yeah.
rinse it with water.
Yeah.
You're good.
I've changed diapers on both intact and not.
Yeah.
Intact is easier. It really is.
Yeah.
Okay, so the next major section I bring up FGM, or female genital mutilation, or female circumcision, or katna, or whatever you want to call it.
I haven't heard that one before, but yeah.
Yeah, that's in some cultures that they call it katna. I even have some pictures of people saying no katna, but the reason why I bring it up is, people say, well, you can't compare the two. It's like, well,
Oh yeah,
you just did in your head, because you're talking about cutting genitals without a medical need. In neither case, it's totally comparable. But what you're mad about is the idea of comparing level of harm. Like,
yeah.
well, we're not trying to have a pissing contest here.
There's a good thing that I have it. I literally have it saved in my notes on my phone for whenever talking to someone and they start bringing up whenever I ask them, like, hey, if you wouldn't cut your daughter, why would you cut your son?
Yeah,
And they'll go it's not comparable, and I just copy paste that link over, and it's from I forget, it's on .edu or .gov, one of those websites. It was a post by a medical journal where this doctor, she's going on. It's called A Rose by Any Other Thorn. I think it's that one. And she's going on and comparing. Like, there's 3 or 4 different types of female genital mutilation, and they are very comparable when it comes to the actual like physical what's getting done to male circumcision, to male genital mutilation. It's the same bits and pieces that are getting nicked or cut or removed. That it's the it was all the same stuff when they were in the womb.
Yeah, exactly. And there was one lady that went over and took a long time in like Africa or whatever, and studied female genital cutting, and she ended up writing a book. I'm forgetting her name right now. I thought it was right up here on this website, but I'm not finding it right now. But yeah, she straight up compares it.
Yeah.
So
let me see if I have.
I'm not finding it right now.
It was A Rose by Any Other name. PubMed .gov or whatever. It's on CircInfo. They have it.
Oh yeah, I bet it is. I'm sitting here looking at Catholics Against Circumcision because it was on here too, unless we might have taken it off.
J. Stevens Sabota. Let's see. Oh yeah, it was Sabota and Robert Darby.
Yeah. Now this was actually a woman that wrote it.
Oh.
Wrote a book on it. So yeah, there's lots of materials out there that compare it. It doesn't take too much time to do a little research on it. But gosh, I'm going blank on the lady's name. But this was many years ago when she was out learning about it. And you can go look on YouTube. There's a playlist by Cliteria Nipples. Great name, Cliteria
Interesting.
That has a whole lot of videos, a whole lot of documentaries on female genital cutting. And after you learned about male genital cutting, and then you go watch these videos, it's like, holy cow, it's exactly the same stuff. There's exactly the same excuses. It's so I ended up working with my son, who's a little bit artistic. Drew a weed with 3 leaves, showing female circumcision, male circumcision, and intersex normalization in the middle.
Yeah.
and then having these 3 roots, and the roots are the same for all 3 of the leaves, right?
Yeah.
And people want to attack one leaf. It's like, well, you 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 might yank one leaf, but that weed is still there, and
Exactly.
it's going to regrow that leaf. So you got to pull it up by the roots. That's my thinking, at least. So
That's
that's
a good way
why
to
I
put it.
bring up
Yeah.
female genital mutilation a little bit, because they're really tied together.
Yeah, they are. It's all the same tissues and all that stuff getting cut away, and then
Yeah.
they want
And
to talk.
even on a sociological level, it's heavily tied together.
Yeah, it's the same when it comes to like cultures doing it. It's the same. It's the same excuses across all.
Yeah.
The whole board.
Yeah.
On we chop up the boy, we'll chop up the girl, on back and forth, right?
Yeah.
It's
There's even you can read Rosemary Romberg's book, but there's some theory that females started doing it because, well, they should be included.
yeah, interesting. I
What's
haven't.
funny, because it's a
Huh.
flip flop of
Yeah.
the people that are saying, well, it's and FGM because it's this is an inequality thing. It's like, wait a second. Everywhere there's female circumcision, there's also male circumcision. It's never the
Yeah.
other way around.
And that's why I like. I think I was reading up that in Yemen, their new bill for ending female circumcision, if I remember correctly, I was reading up on one of the things. It was worded very gender neutral.
Oh.
So if I remember correctly, Yemen had in one bill that was passed mainly to prevent female genital mutilation.
Mhm.
If I remember correctly, they luckily ended up also banning male genital mutilation
Neat.
along with it, which is pretty awesome. And man, that goes to the same thing of like, wow, right? You have Yemen doing it, and you have the great superpower first world nation in the U.S. doing
Yeah.
something, but we're not. We
Yeah.
somehow can't come to the same conclusion.
Yeah.
That
I even heard something about South Africa not technically allowing it either. It's like somehow it's in
yeah.
the law, but not enforced.
Well, that's just like, I mean, again, we were talking about it earlier. Sexual battery is not allowed in the United States,
Yeah.
but for some reason, if we make a medical excuse for it,
Yeah.
it's totally okay. Which,
Yeah, as
no,
long as the parent is doing proxy consent, it's
yeah,
okay.
it goes back to the thing of, I mean, we were talking about, when it comes to the legal system and everything. I mean, it should be, um, it as my wish would be for it to be made illegal and under that sexual battery law and all that,
Yeah.
and the same laws that are there, because if I remember correctly, the US, I think federally, we don't have a law against female circumcision, if I remember correctly.
Now we do again.
Oh, it do again.
Signed
Okay.
by Trump.
Okay, so
Shortly
that was
before
a new
he
one. All
went
right.
out of office. Yeah, there's a new one.
That was one
Supposedly,
thing. All right.
I haven't really delved deep into it to see if it's any
Yeah,
better than the old one. Who
because I
knows? Who really
mean,
cares?
it should be the same. I mean, should be the same across the board, right? Be you a male, female, whatever. I mean, it's you should have the right to keep your genitals. I mean, and as I would see it, right, legally, what I would wish for is if it were made illegal, that it would have the same kind of thing with the Boy Scouts of America and stuff like that, where it's retroactive as well, where they can go back and, I mean, oh man, could you imagine the look on whoever like the all the board, like could you imagine the look on all their faces for like the board of Kaiser Permanente or whatever, all of them just immediately collectively just, oh no, right?
Yeah.
But hey, you shouldn't been doing something bad in the first place.
Yeah.
If you don't want to face again, like because I used all my parents' stuff against them as well. Is if you don't want to face the consequences, then don't do the bad thing.
Yeah.
Right. It's I used everything. I used the same thing of like, hey, didn't you just tell me that if all your friends are jumping off a bridge that you probably shouldn't jump off that bridge, right? It's the same kind of stuff of like, if you don't want to face the consequences, realize that you're doing something bad. And it's not that hard to realize what it is bad.
Yeah. Yeah. So anyways, that's that's the connectivity with female genital cutting.
Yes.
Um, so, you have any other thoughts on that?
No, I mean it's just it's abhorrent, and it's
Yeah.
something that as active as as active as the feminist community is on trying to end FGM and stuff like that. We should look in our own backyard and realize if we're all about equality, if all of us want equality,
Hmm.
then we should look in our own backyard and realize
Yeah.
what's happening here first. Because I'm a firm believer in we should. I mean, as much great as it is to help other people, which we definitely should be doing, but our main focus should be on we can't help other people without having our home and aligned,
Yeah. Yeah.
first. We can't
We
we
can't go
can't
over to Africa or wherever they're doing this and say, stop cutting the genitals of your girls when we're over here cutting
when
the
we're over
genitals
here
of our
doing the same
boys.
thing but for boys, right?
Yeah.
Yeah, we can't we can't judge other people when we
Yeah.
are doing the same thing.
Yeah. Yep. So for those of you that
Yeah.
want to end FGM, well, start here at home.
Yep, start here at home, and you'll probably get a lot more people backing you if you
Yeah.
want to, yeah.
Okay, the last but not the least, social productivity. I imagine how things would be different in the world if mohels and doctors and all that were spending time, trying to solve cancer, or,
Yeah,
something else instead of cutting children's genitals. Spend the time doing the right things. And then there's attachments like you and I that are compelled to spend time trying to end this, trying to educate people,
yeah,
when we could be spending time, I don't know, building homes or growing food.
true. I could spend time, shoot, when it comes to just even personal stuff, I could spend time, you know, doing things better and getting, getting my life in order and stuff like that and all that without it, I wouldn't have to deal with the weight of depression, right? I
Yeah,
wouldn't be
yeah, that too.
dealing with all this stuff if I didn't have to, if I wasn't cut up, if I wasn't
Yeah,
mutilated as a child, I wouldn't have to be worrying
yeah.
about it.
It's that's kind of an interesting thing from the victim's perspective. Yeah, I've known men, I've talked to men that have, what they've done is they've become workaholics in order to avoid this issue,
Yes.
right? So in a way,
Yes.
we've been enslaved by
I
having.
yeah,
I mean,
I can see that.
some of the idea has been to do this in order to reduce the man's drive for sex, so he
Yeah.
spends more time being productive or being closer to God or whatever.
I mean, I can attest that. Yeah, I to one of the I guess coping mechanisms that I have is I try to do as much overtime as possible and work as hard as I can.
Yeah.
And I mean, much to even my own detriment when it comes to the different tax brackets.
Ah,
I
yeah.
yeah,
Yeah, you make more money, but you don't. I actually
exactly.
took some time one time and did a spreadsheet and figured out the tax brackets and everything like that. There's these spots where you jump, you get a pay raise or whatever.
Yeah,
It's like you actually got,
make less
you
money.
just ended up getting less take home pay.
Yeah, I realized that with this last paycheck. I'm looking at my W-2 and I'm like, I got a raise, but I'm making the
Yeah,
same, if not less money than I made last year. What's going on? And then I look at
exactly.
my overtime hours, and my coworkers are like, "Yeah, now you're wondering why I don't work any overtime. That's why." I'm like, "Oh,
Yeah.
oh no."
I keep hoping that the next president or whatever will get a decent accountant in office to
Yes,
draw this up in a way that works properly.
yes.
Instead of doing these bracket things, it's like do it. Do
Do
it.
a line, just a line. Yeah,
Yeah, something. I don't know. It's just there's so many ways you do this. It just requires a little bit of creativity and a decent
yeah.
accountant that really takes the time to figure this stuff out. So I mean, if I could take a darn
Yeah.
spreadsheet and figure that out,
Yeah,
they can find a
exactly.
flipping accountant.
Shoot,
You
it's the
know?
same thing when it comes to what with our topic right now, circumcision. If we can spend 15 minutes on Google and figure out
Yeah.
all the stuff that like how actually shoot, if we could spend 1 minute, if we could just type it into the search bar and have Google automatically throw it in front of our faces, all the
Yeah.
negative effects of this. How?
Unfortunately, people see WebMD and Mayo Clinic, and just all
Yeah.
they see is benefits of circumcision.
Yeah.
They're not provided the functions and the anatomy and how it works or anything. You know.
And they don't publicize the risks and the different complications of it. Like they're not addressing the fact that right shoot, when you
Stenosis.
look up on it, you can't see that where it won't show you that metal stenosis is a side effect of circumcision. But when you look up metal stenosis,
Yeah. I
they
know.
say it only affects circumcised men, and it's
Yeah.
I think it's 1 out of 10. 1 out of 10 or something ridiculous like that.
No, it's actually higher than that. According, Brian Earp did a tweet just yesterday.
Yeah.
It's like it sounds like one, like a third or something. It's like a pretty
That's
big number.
insane.
Like, yeah.
Right. And they're not going to publicize that as any of the risks. You have to look up the risks
Mhm.
themselves, and you have to so
Yeah.
then you have to know what the risks are.
They're not straight. They're not complete. Yeah, the medical industry really has a lot of room to improve on this, and
so that where it goes
I
to
even wrote
yeah.
a humongous, I mean, a thick letter to 8 editors of a urology book that was edited for 2020.
Oh wow.
Yeah,
That's
because
awesome.
there was so much.
There
I
was-
like I would take screenshots of bits of pieces of their book and say, well, here's your problem with this, here's your problem with that, and here's links to these articles or these studies or whatever that
Yeah,
address this. Your book is horribly biased towards circumcision. So
jeez. And even in 2020. Oh, wow.
yeah, in
And see that's
2020.
a goes to the thing, right? Isn't that supposed to be peer reviewed? It's supposed to be
Yeah, it's
all
peer
the
reviewed
peers
by
are
a bunch of old
old men that just
yeah,
are set in their ways,
yeah,
and they don't. Because see, right there is what you're seeing is I don't know if it's called cognitive dissonance or what, but you have a bunch of people that my penis is totally fine, I don't
yeah,
have any problems with this, so we're just going to keep saying that there's no problems with it so
yeah,
that I feel better with myself. No.
yeah,
You should realize what's wrong with yourself, and that would be like if them saying oh man, I'm an old person. I had a horrible diet, so I have congestive heart failure, but I'm a doctor and nothing's wrong with me. So having chest pains is okay, right?
yeah,
That's the same thing, right? Having a broken penis is not okay. It's the
yeah,
same thing as having broken heart, shit like that. It's not okay. You should probably get that checked out. But
yeah,
you don't see doctors going around saying, chest pain's okay, right? So for some reason, it's their sex life that they're worried about
yeah,
and all that craziness. But I mean, yeah, it goes into that. It should be for some. Or yeah, there. This is what I was gonna say. It goes into right if they're having to use right, they're having to use subterfuge to keep it going along.
yeah.
Then it's not okay.
That's scary.
Like it's scary. They shouldn't. Yeah,
You're
there's
afraid of
something
getting
wrong
sued.
with it. Yeah.
Yeah, by
So
telling the truth.
if you go to look up online, right, if you're an expecting parent or whatever, right, and you're going to look up online on should you leave your son intact or not, and you're looking at all the all the information out there about circumcision, and they're lying to you, they're straight up lying to you on the Mayo
Mhm,
Clinic or WebMD page, right, and
mhm.
they're not including all of the risks and factors and all
Yeah.
that stuff with it, right, and they all always say, oh, there's always a risk with everything, right.
Mm-hmm.
They should have a drop
Awesome.
down list of everything that could be a problem with
Yep.
it, right? Just like everything else they do. But with this, they're not going to tell you about it. So
Yeah.
if they're willing to not tell you and warn you, and if they're willing to lie to you to get something to go forward, then that's a problem in general.
Yeah.
And it goes back to it's a money, it's a profit thing,
Mhm.
right?
Yeah,
They sell
I'd
them.
like to know if there was even one single intact man on the AAP circumcision policy board.
I would be
Yeah.
thoroughly curious,
Yeah.
honestly. And then because I was also reading up, it was that same. I think it was I don't know if it was the American Circumcision documentary or what. Um, but they're going on where there's a lot of even other foreign doctors that came over here to the states to go to do schooling and stuff like that because it's great. We're America, we have the best schools in the world, all that
Yeah.
stuff, right? And then they get into the Kool-Aid drinking of, hey, circumcision's great and all that stuff.
Yeah.
Well,
Reduces
why?
HIV.
Yeah. Then, I mean, that leads the question of like, so did you circumcise yourself? Like, are you gonna do it? Like, if you
Mhm.
were a doctor and if you were born in another country, nowadays it's any other country,
Yeah.
but the U.S. And you were intact all your life, your culture's intact, everyone's doing okay, and then you come to the States and they feed you this. Are you
Yeah.
are you willing to go do the procedure yourself and get it done on yourself, or are you just gonna preach it without you know
Yeah. Well, luckily, it seems like most doctors that come into the U.S. for training or whatever,
yeah
they're against it.
they're
There's multiple interviews, videos you can find on YouTube, and I think Bonobo 3D's channel, whatever.
where they're outside the American Pediatric
Yeah.
Association thing and they're interviewing
Yeah.
doctors. Yeah.
Yeah,
Yep.
and they say, yeah, we don't do it over there. We're totally against it.
Yeah.
There's like a doctor from India that was interviewed. There was a doctor from
Yeah.
one of the Nordics that was interviewed,
I think it
and a
was
doctor from Mexico. And all
yeah,
of them were like, yeah, no, we're against this.
exactly. Yeah, there was I think they were interviewing a doctor from like either Brazil or something, and he was like, "Oh yeah, no, I think it's ridiculous. I think it's bad." And so whenever I have parents come and talk to me, right, and they're going to talk about
Yeah.
circumcision, I'm like, "All right, yeah, sure, I'll sign you up for that." And also, do you want the fingernail removal, the toe removal, so they don't stub it anymore, right? Do you want all this as well?
Yeah,
It's like,
let's reduce
yeah,
athlete's foot and toenail fungus and gout.
yeah,
Come up with a whole list of things, that there's benefits to
exactly.
removing the toes for. Why not?
Yeah.
And I'm sure we could do a study to prove it.
Yeah, we'll do a study that will prove it,
Yeah,
definitely.
yeah, yeah.
Give us
You
some.
can preemptively remove all sorts of things and prove, hey, we got benefits.
Yeah, see, the problem is there's no market for feet. I mean, oh, I guess with OnlyFans and stuff being a thing, there is a huge market for feet, but
Oh, I'm sure they can figure out a way to
gotta figure
get
somewhere out.
the T cells or whatever from the toes of the baby, and
Exactly.
it's not being a penis facial; it'll be a
Yeah,
toe facial.
toe facial. Yeah, you're gonna some fungus.
Yeah. Hey, we eat mushrooms. It's fungus, right?
Exactly. There you go.
Oh, well, Kyle, it's been a blast.
Yeah,
Chatting with
it's
you.
been fun. It's been very copacetic, talking about a lot of things, getting it off the chest and all that stuff, and yeah.
I think we need. I'm happy that I started doing this. I had another reason for doing this, but I'm finding a secondary benefit of interviewing advocates for genital autonomy. I think because of this pandemic, we haven't been able to be connected. We haven't been able to get together and protest on the streets and hug or whatever, or talk in person. We haven't been able to just get together and have meetups or whatever to chat with fellow advocates.
Yeah.
This has been a bit of an outlet, I think, and I'm hoping that maybe it reduces the burnout a little bit for advocates, and maybe people will be able to do more advocacy work.
That would be helping people get out while we're all stuck in.
Yeah. It hasn't completely stopped me from getting out and
Oh yeah.
protesting. I don't know if I said this, but I protested at the hospital where Andrew works, right?
Oh no, I
Yeah,
didn't know. What
yeah,
really?
downtown LA. That's where he works. Yep. Myself and 1, 2, 3, 4, 5, 6 other intactivists were holding signs there.
Nice. Go right to the source.
Yeah. We didn't get to see Andrew, but I did talk to one medical person. It's like, hey, do you know Andrew, the guy that showed up on the American Circumcision documentary? Yeah, we know him. Like, awesome. Let him know that we were here. Tell him hi for me. Yeah.
That was wild. Circumcision is bad. I did to my son though. Whoa.
Yeah. All right, Kyle, you have any other thoughts on this before we close up?
No, that's about it. Yeah, I mean, it was a good talk. I really like, having conversations and stuff and talk about things like this that, I wish it wasn't controversial, right? I wish
Yeah.
this thing was just a generally known. I mean, well, again, I'll go to every other country. It's not controversial.
No.
But I love.
I get onto a call once a month with the group is called the Bodyguards. It used to be
Mhm.
called International Coalition Against Sexual Mutilation, but they didn't want to
Yeah,
scare people away with the mutilation word, so we renamed it to just something simple.
nice.
But yeah, there's people from all across the world, from India, Egypt, many places in Europe, Australia, all getting onto the call once a month, and we always have presentations and stuff like that. It's really interesting. So yeah,
That's cool.
yeah,
All right. Huh. That's cool. That we have some help
yeah,
from
yeah.
outside the yeah.
Yeah, they have different perspectives on this, and it's kind of interesting to talk about the differences between the U.S. and like in Europe, the people that fight it there are like 15 square. Their focus isn't so much on fighting it, but helping men that are struggling with the um, the trauma and everything. Um,
Yeah.
yeah, so because they don't need to fight it so much because it's already pretty much accepted by most of the country that no, this shouldn't be happening. They haven't necessarily succeeded in getting some of the religious factions from doing it, but
Yeah.
compared to the high cut rates that we have in the U.S. and the cognitive dissonance and everything like that, they don't have to deal with that as much, and they don't have. There's the bloodstained pants came from the UK, if you didn't know that, but
Oh, okay.
yeah, they don't have near the number of protestings going on over there like we do here, and don't have the angry um, man situation like we have here in the United States, and that turns them off a little bit. But after I explained to them how things work here in the U.S. and kind of referred to, well, look at who ended up being our president, when
Yeah.
Trump was in our in
Angry
the ranks.
Cheeto.
It's like, well, look at how men act here in the United States compared to there. This is
Yeah.
why. So this is why we have men that are angry, and I keep expressing this that we could try to be gentle about educating people, um, but that doesn't always work. Especially, well, here's the thing: you can give people tons of information, but if they don't see us men speaking out and saying, "Hey, we're pissed, we're upset, we're
Yeah.
angry, whatever," and even saying some nasty words to which really clearly shows that we're angry, that anger might scare some people away. That at least they're walking away knowing that they met a man that complains,
Yeah.
and they'll think about that. They'll consider that instead of walking away. Well, here it sounds bad, but I don't see men complaining.
Yeah. There
So if men
is.
aren't complaining, that must not be that bad.
Yeah.
So
They
you
the
gotta
fact
show
that
that.
you get men complaining now, and yeah, getting the yeah, it's
Yeah.
yeah.
Just like we see women complain about FGM. You look at
Exactly.
Hebo Wardier and some of these other women that wrote books and stuff like that, and people respond to them because they, instead of being, they do get angry and verbally violent a little bit, but for the largest part, you see them cry. It's sad
Yeah.
and whatever. Men aren't raised to cry.
Yeah. We
So
shut that down here in the
yeah,
States, and
well,
it's
so
very
that's a psychological problem. It's
yeah.
basic psychology. Whenever you repress your feelings, what you're doing is you're creating a bomb.
Yep.
So then later on, it comes out in a very dirty bomb way.
Yeah.
So you can't really expect men to be all that gentle and all when they've been told to repress their feelings for so long.
Exactly. And it goes to oh shoot, I was gonna. Oh, there it is. Kind of. We touched on this topic a little earlier with societal. And the way you get society to change, people think it's all these different things of punish and whatever, and call it out. But the biggest the biggest way, or the easiest way to change society and to change people, is shame.
Yeah.
Is just
Sad, but
it is, and it's because it hurts. Shame is also one of the most hurtful things.
mhm.
But I mean, I'm not calling to shame, you know,
Yeah.
parents who cut their children or whatever. But like, if the if they're not regret parents, right? Or if they don't
Yeah.
regret their decision and they just cut up their children, then yeah, it's shame is the only thing that we could do to be like, oh, well, if their friends look at it and go, oh, well, they got told off for cutting up their child. Maybe
Yeah.
that's something that we shouldn't do, right? Because we don't want to get told off too.
Yeah. Well,
So
I can't shame people for ignorantly cutting their
yes,
child,
ignorantly,
right?
yeah,
Because I almost let it happen to myself, or to
yeah,
my own
yeah,
child. Right?
yeah,
So I can identify with that ignorant parent.
yeah.
um,
But if they have all the information put in front of them,
yeah,
and
they
or
sit
I
there.
mean shoot, or if they're doctors, right? And you're
Yeah,
supposed to be a doctor, and you're supposed to, you know, peer review.
yeah.
And yeah, I mean,
Well,
shame is
yeah.
the
I've spoken with doctors in person. I talked to a urologist one time. I called his office and told his office how mad I was cut and everything. And surprisingly, the urologist actually called me back that evening and
oh
had
wow,
a long conversation with me. And he came up with the usual excuses that us autonomy advocates are used to seeing, hearing all the time. I mean, it's like the circumcision bingo.
yeah, yeah,
And it's like I was ready for every single one of them.
yeah,
I responded to every single one of them, and at the end he's like, "Well, you make actually some really good points." So it's like I didn't have to shame him. I just addressed each one of his excuses and the claims and everything. And I don't try to attack the claims that it's better. I mean, there's plenty of stuff out there that does, but
yeah,
I appeal to logic and ethics, right?
yeah,
And logically, it doesn't make sense to say let's cut this off to prevent something that just might happen in the future.
yeah,
It's a functional, valuable body part. We don't cut everything else off. So the logic is easy enough to just throw all the medical benefits claims to the side. It's not important to discount those medical benefits as much as there's plenty of stuff out there that will. But I
yeah,
that just gets too bogged down to me I could spend hours and hours and hours trying to do that and getting people to read other studies or articles or whatever. So yep.
yeah. Well,
Hey
um,
Kyle, we had a long talk. It
we
was
did.
like over 2.5 hours, I think. Right?
Yeah,
Something
I
like that.
was. Yeah, I just texted my manager a few
Oh.
little bit ago, telling him that I was gonna be a little late for work, but it's good. I got time.
Okay.
Yep.
All right. Well, I should
Well,
probably wrap it up because it's going to take a long time for this long recording to convert, and I'll hopefully get it uploaded to YouTube tomorrow.
Roger that. Awesome. All
Okay.
right. Well, it's been great. Yeah, love to have a conversation again, or I mean, if
Okay.
we got group things going on too, that'd be cool. But
Yeah. Check out what Jordan Norell has been doing. He's been having groups.
okay, awesome.
Yep.
All right.
All right.
Well, have a good night.
Okay. You too. Good night.
Thank you. Bye.